Taum is at the chew doesn't chew mesit a hotini day. A taum is at the chew doesn't chew mesit a hotini day. A taum is at the chew doesn't chew mesit a hotini day. So not si masi dutzane kone na hakone o. Se masi lilani joajok ashu kletzehte. Se masi ajo sene zina heko o. Juna hen kauve kesi sene zuna hen dezeke na natoke fet a sekuts anenti. Gotai jitsek eshu ajitanet ena hekenine lasi se met a utats atet a senats anenti. Na he ti wund a se junats enide na he zi na kenine lat a se ne zutite na henta na hekenine lat a se ne zutenegats uta na he vana kenine lat a se ne zukats ute na he la na he keshu met a se ne zuinta egalats etaga se masia si kanet enhanela ami kaniko tiguli si sene ziko kenenti kaga joko chagyuni waking edaji sene ziko nenti gots on sego keli shunatsanele na hi shuju khatats ehtisi sene zyojo na hets anenti se masi dutsene konen hagone o se masi sete kamari se notsi sene zykets and ana hets anenti masi a taum is as a chew doesn't chew mizit a hoteni day. A taum is as a chew doesn't chew mizit a hoteni day. A taum is as a chew doesn't chew mizit a hoteni day. Masi.
College, I'd like to thank Mary Jane Kazon for the guiding words here today.
Kayanak Mary Jane Kazon, tabra kinakambit. Isagot tinaktit uvar. Ukakti. Tamna minitak. Maka tamna. Kaykavit maunga kayanak. Pula kavit. Polychinetary pulaktok. Where?
Can't see her. Oh, there.
Minitaka maning nika munakri. Got kanaka tap got tangungi chotabra. Kanakole katabra malerota leonika maling neling yakut kanaka tangungi chonika havaktin yakluich. Tap got the kanaka kanak tap got havaktin yakaming kamiting tabra tap got tangungi choting kanaka ikayonak kilingin yakait. Kanakole katabra ikayonak luit kanak tap got tangungi chot habang nektot kavamani. Kanakole kai kayonak yakait. 22, 23 tap got habang kaming tap kiyani tap tumini. Kanakole katabra ikayonak yakait tap got. Got kanaka lihanik to tabra havaktin yakluit kanakole kayonak luit ilihaktin yakluit kanaka tap got kuchik toni havaktin yaktot managers nikta hugait taapkot tabra taapkot habaktinneeliginyarait qaneq taapkot tabra kavamani habaktinneeliginyarait taapkot Indigenous Career Gateway Program niktayugay tabra qaneq tumitsu lugit taapkot inuit tabra qaneq ikayorniarlugit inuit tabra taapkot kavamani habaktinniarlugit qutsiktuani havat taapkot GNWT taapkot katiliginyaqqut tautsikun katiliginyaqqut qaneq tautsikun oqqaarivlugit taapkot qaneq ikayornaqqilu gait qiyanaq tabra Minister of Health and Social Services oqqarniartit 20th Assembly taapkot taapkot ikayornialiginyarai taapkot anniartuat naaganulin qaneq ikayorniakkangi taapkot qaneqliqa tabra munarniarliinyarai taapkot nutaq inuit tabra qaneq anniartuat naagaluunniin munariñat tabra taapkot qaneq nunaptingni tabra qaneq taapkot ikayornaqqigalualiginyarai taapkot ikayor tinniarlugit qaneqliqa iñungnik maanga qaneq taapkot habakparaliginyaqqut qaneq ikayorniarlugit tabra taapkot anniarvingmi taapkot primary care clinic tamna pulaarnaqtaaqtinun clinic miktayhugay taapkot ukot hospital mi anniarvingmi tamna taapkot 10 to 16 tun taapkot hinigving raniliginyaqqut tai long term taapkot inyaita hiniktarvingit tabra pinya piffaarnialiginyarait hiniktai
Mani Northern Territories ni tapkot munaqayakrangit hinigvikrappaam nginnik ivaqlaqanialigit kait tamatko tabra tamattuma puvaqlugniim na hapeqraqti takkangatigut nutqarti taqatalu agilaan pangmapaktainna isakutit qiligitsuguttainna havangniaqhuta taaptimani anniarvingmi taitna tabra taaptimani allami huli igilumi na havagvikrami taapkot anniartualiqiruatit na tautugaartakrangit taapkot illiqiliginneqquttamatkuninga taitnalup taaqtabra nuktallagik vut waptikkun taapkua katimaringita qanoqangalatsillaru taaptuminga tavalutai na tautuuqramingnik tamatkuninga tamatkua tautugaarigait taaktileqiluat quyunarpak uqartii Prem-Lake-min quyunaquqartii uvanga isagutikama isagutikaptikpakraaq tamatkuatiitna tavalutaitna tamatkuatiitna uqautigikavut qanoqqitna tamatkuat havauttaqikkaptigitiitna illuatun havauttariakuraqaluavutitna pilaitsutiiqaangayaqilugit tavalutaitna аллангортуарuna tavalutaitna ilitsorip kairakranik itnaagalaktanik peqartukraugaluartut tamatkua ilitsoriniartuat ilitsorirakraginnik tavalutaitna kaverangnikitna nalunainngutserarigait tamatkuatitna aullaqinia hivunikramingnik aullaqiniartuat tavalutaitna tamanna imakuntauq uqarimmikkangataamna tavalutaitna 1993 mi tavrani piaqaluktaqamata uquliaqqimaittsortaamna tavaluptaortaitna qanoqtamanna imakun itna uqqari ilitsorip kailaqaqaluaguut iloqata taitna qanoqitilaanga tamanna tamattuma imrum savuptaortaapkuat katimaringita taapkuat tavra himmauheqtarpatigitinna ilitsori ilihimalukraaluaguut iloqata qanoqlu tavrani taitna tamatkuat tamatkuninga atanneqquiruat imakun naagaluuni nunamiktigut quyunaq Range Lake-min quyunaquqarti tavraukuat uvlaakun tavrataitna 11 tun hanahuirutini tavrataamna taimaaqimagia tavratamatkuat tavoqqitna atiluartamatkununga taangalaarniartuanik taitnap tavoq atimmiuk taapkuak taimaarniartuni tavalutaitnap tavoqitna quyagiarakurarigaluavut tamatkua taimaaqtartuat taitna ingmiktigunnaagaluuni ikayorteqqaqutin tavalutaitna tunagalaan maani nunaaqerpangmi nunaaqerpak tamana ikaaqqaarataqalugu taitna tavra tamatkuninga tamatkuatiitna ikayortakrat ilihimagivut tamannalu tavra siga tipaakoqqitna ilitsorikkarput qanutunagalaan akihuiruaq ilitsorihimagikput akitsoqqiinñartoq tamatkua taavangahaaqalukitna taavangahaaqaluk taitna sigaanikitna qaaqatsuuliaraarrutin tuniuqqailaraartut 3.5 billion time taitna tunagalaan nutaqaulan matkuaptaaq isagutiruut tamarra sigaanik sigaaqtalequtin tavaptaaq taitna qanoq taitna ingmik taimaarniartuat ing mingnik kihenik tay makakaktut. Tabro na medihin tawra na ilihimarunga tamat kot minihita lakating tay na tam na tamat kuning nga isumalu aktut. Tay na lo akaw tigiblup tak taman na kuyanak pagkakakti. Kuyanak ko kakti. Inuvik put like me. Kuyanak ko kakti. Kakti. Tabra ukuat na taman nangit tuat isumak tuat tamat kualoy na kanok tamat kuning marehimatlong nik atok tuat. Tabra tay na tangungit tuat na ing miktigun tay na ngalat siraktot inawralani. Tabra luptak tabunga awlaw tirakalugit pigalo akagay tamat ko tay maknak tuat awlaw tirakalugit. Tabra lutay na tamat ko tabra tay na isagutit kiligit kay tabunga awlaw tibilugit na ikayok na aklugit o kaw tibilugit kawan salakak tut tamat ko o kaw rironik inyungnik na skito ako ting nagaluan ni tamat ko nga hunig ilakaki awla tikraming nikilitri kaming awla tikraming nik atokake tut hunig ilaka skito nik tamat ko nga lo alla kayanik side by side mik pirakagay tamat ko awla tit hunig ilaka tamat ko nga atularonik atokak
Sorry, Mr. Speaker, but I can't provide any spoilers right now for the show. The rental property.
Tapkolu tabra tay na ito naglani na akitchalo aktilugo taman na nakinik awla tikrangin tamat ko din na ikayutiluta.
Speaker. Over the past year, under the leadership of Grand Chief Ken Kikovichik,
Tap ko tabra Kuchin Tribal Council. Kati maringit. Dahil na tamat ko nga isang utiligit ikayutik siya tayo malaya kanya aktuanik kayanak. O kafaw kalakto nga inuit nagaktong ikpan nga. O kafalar din nagaktong inya matin. Tabra ukwati na tabra lutay na igilwilyok to tamat kod ilya kanyaligit kitka tabra ni taputilugit kanakuluptak tabra tay na ukwat lutabra kapamat mani ikayok niya katigut waptik kun pilay kikput tabra luptam na pitkura nugu apakra gupta minihitanik kaya nakpak Grace slave me kaya nakakakte tabra tight na tinagalan tamat kuatit na santiak pada tam na hilyame kukiok paurakidut. Tam na kuyagiblugo. Tabra tay na katimap kaya niya litsidin yung hilyame narep kaya luting. 1990 tabra tay na kugalwaktot. 2023 tabra tay na kakata kaming inuit na kuya chay rakigay na tamat ko nga ang may kaming. NWTMI. Tabalutay na ilokay ni katawlugit tamat ko na kihimreong itchut ilokay ni katawlugit tamat ko na iglulek hirotigun tawak tam na ukaw tigilaw kiga. Wani inipting ni inakpang mi yellow knife mi. Tap ko na tay na tuhara kaibut kanok ang alachirot. Tabal tay na kanok kihul da ka tuhat koblugit ilicharit koblugit pigibut. August 9 mi tabal tamat ko na tabal tay na isumati kaptigit takugaming nagulkaong nakirok tay na kayong ihoakap tigit kaya nakpag.
Today.
Kota ublupaka satu kanok habak tinyak luita kanok implementation niktay hugaita kanok habang niyak tot habak tinyak luita kanok tapkot August 2019 tamna tapkot humiyaka tautung na humiyaka inuit pira habak tot public lands nik tay hugay tapkot inuit tabra inyingit humiyaka public lands nik tay hugay tabra. Kanok tapkot tam na isagod niyak pa dong kanok tam na land act nik tayo right tabra malero taliok kanok isagod niyak pa dong tapkot habaw kaklu tayo na isagod niyang ichok aglan
In order to create a newer, more efficient model of administering land in the NWT. This new process would minimize land access confusion and establish a one-stop.
Ogot tabra malero talut kanok havanagudu pat tabra nakuro kun pinyak tut kanok at hokapa nek tunga anu hokapa lang nek toka satumi kalanak tapkot kanok init kanok hok isagutin ginyak patuli kanok tapkot kabamani habangin niyak parung tam na kanok isagutin nakigalok tok kaya nak Mackenzie Delta mina kalang niyak tok kaya nak Shaman Kila Tabra Inuvialuktun. Happy birthday. Kuyanak. Tapkot apkodakpak Tabra Dempster Highway apkodakpak kanak tamna Inuit atok para ugat tamna. Tapkot tutkik karnak luita tapkot kanok tamna apkodakpak pilyukang tingilakan. Tamna Dempster Highway Tabra apkodakpak. Tamna Dempster Highway hamma taudi yokonaktok kanok tapkot Inuit tabra aulak to kaming nagalunin tamna akrali akoting atok kanga tamna Dempster Highway. Tabra tamna atok para ugay kanokay akrali paita tuyok luid nagalunin tamna tabra nekinik nagalunin hunig laka atokonak to Inuit mani nunapting ni tabra taptumuna akrali kun tuyok ugay. Tabra Dempster Highway tabra nakupiaktok anu o kapfakanaktunga. Kuyanak. Tuniday walday. Kuyanak. Tapkot ilihakanakto tabra kanoklika ikayonak hirt. Kanok. Tapkot lutsal kemi tabra tapkot ilihaktit kanok aglalingin yakut taimarne akuting kanak at lutsal kemin. Tapkot nutakat ilihakanakto nuligin yakut inauramun alamun. Tapkot ilihaktonik tapkot ilihakanakto nutakat tabra angayokangit pingikraligin yakut kanok pinyakto tapkot nutakat kanok ilihakanakto tabra tapkot kamamat mani tamna tutkikar nearat kanok lika tutkikar nearat tamna ilihakanakto nutakat ikayorlugit kuyanak. Dicho. Kuyanak. Uvlupaka okarineriga tamna kanokawlak tuat taktiliak tuat nagalunin kanoklika awlakaniak tuat taktim annervingmun kanok awlak narut kanoklika tapkot ikayorneligin yarait kanok tapkot Tap to muna. Tak tiliak na akto ka ikayungin liling atit. Tabra okwato ka kanok ikayak nakiritap ko tinyuita tak tiliak na akto at nagalunin kanok awla urtain na awla Edmonton mun tabra tabong hakar ka awla linya katak tiliak koting tabra kanok ya ni haper nyak hehur kanok tap ko tak tiliak na akto kanok tabra ikayak nakikitap ko tinyuita kanok inyo ni akto tayo na kaya nak techo mampui kaya nak tap kanok lupak tap tuminga o kakanelagin niya kung tabra good governance mik tayo gait kanok ingiliran pi isaguti kama kanok ingiliran isaguti kama tabra ikigalak aglan kanok tabra habak kamamani kanok habak para kanak tabra ila ni haper nyak hehur kaglan ukot habak kapta tauchikun tayo na kanok leka habang niya kama tabra nakuro kun habang niya kuro nga kanok leka muna bliwi tinyuit ay mabim ni kanok leka tap ko ang iyo kama na kalun tatama kanok isaguti kanok leka tabra isaga
our people with kindness and respect for one another. Mr. Speaker,
ilihaw ti hungang tatama na ang iyakam naptak kanok kanok leka tabra
people are passionate about issues. They want to get results for their constituents.
Member from Hopefully, your time is up.
Mr. Speaker, can I have unanimous consent to conclude this meeting?
Thank you, member. Member has asked for unanimous consent to conclude her statement. Any nays? Seeing no nays, may conclude your statement.
Okay, there are some of us
ukot ubagut MLAs tabra kanok
as assembly can move forward together in a positive way. We don't always need to be at each other's throat or tear each other's down or arguing just for the sake of arguing. Both sides of the House must come together in a good way and work as a team for the people we were elected to represent. Thank you.
Thank you, member from Hopefully. Member statements, member from Yellowknife North.
Thank you, Mr. Speaker. I've been speaking a lot about our huge challenges with literacy in the NWT. Today I want to celebrate
Tap muna ukakaneakto nga tap kot ilihakaneaktot kanok June 2nd tap kot ublupak June 2nd mi tam na ilihak neaktot dabra yal knife and river tap kot kanok tam na tap kot pinyalingin niya right tam na kanok
McCreesh, Stephen Kakfui, and Marie Wilson.
Top court Stephen Kakwe and Marie Wilson. Top court daw ka Allison. Top court kanokle ka tam na
Readings from their books and having discussions with the
Inuvik Centennial Library mi top court dabra hokarinia liginya kay top court kanok kay haktonik. Nagalunin magtiranik habaktot kanokle ka pipkarneak luit ilihauteneak luit inuit tabra kanokle ka festival nik tai huait tabra yal knife mi tabra 6:30 p.m. mi tabra ay jagudineli niya kot kanok tau chimu para luting kanok tap kot kuyanak Yellowknife North Yellowknife Center. Tap kot havang niaktot wellness workers. Tap kot havaktot tayo kanok tap kot havaktot tayo havaktot tayo tayo mangitchut kanok tabra isag ikayo ko na akluit inuit havakto tayo na Hukwat social workers ko tabra habak titap ko at ikayo ihuro at yung kanokle ka. Kanokle ka tabra tap ko at
move them along. But Mr. Speaker, both examples are
Tayo na tabra tamat ko atin na isuma kaming kanok habaw te kanyak pitiyo na. Inuvialuktun tayo na inuit isumaraktut. Tabra na ilan ni isumawra kapta hapernak to akri rotun itaktok taman na tamat ko atin na isagutik kangit. Tabra tayo na ilihimarugot ilo katak kanok inak tila kring tapkot. Tabra lo tayo na dutakakay din na katimarot at taramik na pekpak ko tayo gigtot ila niptaok tamat ko kanok tamat ko na tamat na isuilyakakto kanyuni ako tikputi na ilo iwagtaok na ukakapta uwaptik kuntaok tayo na taman na isuilyakto aton pilyakto tamat kuninga tabalo tayo na inuitin na ulokog pan una inyuk ikayo kaya kalakpot ilo kada tayo na isumakakta tayo na ikayutiksanik kiheni kisimaluta. Romero's trout. Tam na tabro kautikillang neriga. Mickey Mick pitariga tam na. Stella. Tabratapkok April 26. Tabratai malaktor to halit kikput. Tabralutai na tapkot na. Time harmony na tutko kamisung iluatun tutkoligin yakat. Kanakulu tabra unan. Tabratai na ilihimaluguti lakatat tait na. Ataramik tait na inyong mik pakalakapta. Pakalakapta inyong mik tabratai na iluatun. Iluatun tapkot paktabutit na inyong nakatigi. Naktilak na lugalawak na inyong nakatigi rakibot. Tabratam na tabra. Mekpek paganito ni nutakani. Tabralutai na nutakani pirakagait. Pekpagak parani bluit na luitluatun inyong na. Inyong nakabluit o kautilakagait. Tabralutai na hapekrangi chokin na hapekrangi inyakruya na guti kami kanokikayokti kami ibakala kami. Tabralutai na tabratam na naraktorakakayatam na nalaw titigun tuyok tara kaming tuyutira kata kaming. Tabralutai na tamatkuat na kuakanikangit naraktorakaningini tuyok taraktoani. Tabralutai na ilihimatungatai na nutakakit na tauchimidluit nutakkanilo tait na humulaka nuktaorok mani. Nutakakit ilokaiting na pichak paurakanaakatam na. Matkuat apikrutakaktot utere. Inuit pulaktaktot ilihimabihit. Kuyanako kakti. Tabrona. Palichina maunga pulakaman kuyayak paralit kigay kay habakatiga. Pichak paurakiput. Everyone knows me. Nunakput me. Nunakput me. Natalie Josh, Kiana Bernhardt lo. Lo haktumin. Kuya nakparak mga kape, kuya kipi. Techomin. Kuya nako kakte. Friday me. 24 25 tam na kanokangalan na aktilakrangit iliri jodi uminga. Tabalaptak tamat kodi na kanokangalan na aktilakrangit tam na kinyawrak. Ubani hibon nerwik pang me. Tait na lo tamat kodi sa kagikangit piaklugaktot inawramingni. Inawrangini piaklugaktot hapekraktaktot tabalaptak tamat kodi na ukakte Tabe lokain ilihimagibut tamat ko din na ulak takto tamanga NWT min takpa nga na isoak to amik habag wikraming nik ibakalekoting. Tabe lutawila ni aulak kami tabrang inauraming munakariroanik ibakalerakoting iglulakiroani. Tabe tap ko tabe litsokin mat ko din na upang niakluit tamat ikayuirot inyong nikit na hulektoanik nagalunini na ingmiktigun na tamat ko din na akilil liakluit nagalunin iglulakiroanin pia kami. Tabe tay na inakpang mituat mikiroani tabe na isumalu takaya. Tabe tay na mikiroani inarani ilihimarat ka tay na inyuna akong harit ka. Mikiroat matkot at hilugit matko nang inakpang nit. Tabe tay na tabe tamat ko din na mani ingming kabamakaktuat inauralani atu habaktuat mat pilyaw takolerit ka. Inauralani. Tabe tamat ko din na pigo mga kalugitap ko takpait. Tabe tay na tamat ko ding miktigun habang neakto ding miktigun habalgit. Tabe tay na atokrangin ki inauranik inyuga kita. Tabe na hibulariga. Tabe tay na tap ko din WTMI. Wani munakri ramni inyong nik 2020 mi tay na tuhanak tok. Tabe tay na mikiroanig na aulaki roanig ing miktigun hawaligit isagutirangit. Tabe tamat ko di sumait kugit ka mikiroani inauralani isumait kabulugit at hilugit na inikpang ni. Tabe tay na tamat ko muna kayo krapi akalabot. Mikiroani inaurani itot ing miktigun na aulakani haktot habag tot ing miktigun habaligit. Tabe kulak taktot mat ko di lihimagibut inyuga tot tabe tamat ko kairakaktot inaura nun mikiroanun. Tabe tay na tamat ko ikayokraw piaktot na pulak taktoanik munakrirot. Tabe tay na ilihaw tilugit kanok pakniakangit inyuit tabang haro kairakaktot itotun na itotun tamat ko pigit inyun kairakaktot maunga pulak takoting. Tamat ko tabe tay na ilihaw tiurakto ni ing miktigun habaligit ing miktigun tamat ko na kokta kayakaitin nalo huamahakayakait tay na ilihimaguming kanok inyunekto tabang hakaruk kaik pata panaguti gumitigit na isotun okaw tilugit. Tabe ko na ilokata tay na tamat ko na hibun niyoktit tai nalu tai ibakot ila ilitsokiniakalabut tamat koatina ingmiktigun havalgit nagaluni mat koatina ila ilihimarabut kavamani havaktot kanut nagalan tamat koat is kinyakakabatigit ilihimabatigit kanut nagalan developtak tamat koati naing mik tamat koati kayuirot kinyaranik kayuirot nagalunin nikikirangin niki kayuirot kanolakaki kayuirot tamat koat tabra social service nik pirakigay kayuirot kehunik laka habalaylanik ing miktigun kanologiti kayonek pitigit mikirani ing miktigun habalgit ilo kainik tabertai na isummatigina yakaibut tamat koat ataulugiting miktigun habakaktot ikayokolugiti tamat koat isagutirot hing miktigun habanagutirot taitne ikayurakalugit huamahit kablugit isummatigin yakait katamat koat hing miktigun habalgit tabra uam niptaukit na inauramni taitna habautakikkat kaukot tabralu taitna atauchikuni nanutakakait ilan ni habagaktut tamat kuninga ilokata tabra taitna igilulakirotigun taitna Mani Northwest Territories igilulakirit matkoati na isummatigina yakay isummatigit kagalawanikit kahit na angalachironik igilulakironik tamna tauk igilulakironik tamna igilulakirot na kuchikit kagalawanikit ka kinyaurangit na atutikirangit tamat koat tutkikainiaktot nagalunin tabralu taitna tauchikun na tamat koat angungitsodit na ingmiktigun kamamakaktot taitna tabra pangmapak igilulakiroani ilihimarunga kanok tamat koat na angalalau taktangitsot nagalunin hibunmungitsot tabralu taitna tamat koat isummatigit kaptigitit na tap koatit na isummatigit nalaunakitsutit naktangayarlugit tamat koalu inauralani mikironi inaurani tamat koat ilihaktot isumalugiligin mitka taitna tamat koat tabra ilihauraktot tilat ni hapekralakaktotit na kindergarten nganin grade 12 mo naglanit na nachilaraktot grade 12 mo kaming tabertap koatit na hapekrapiaktot na pilyaw taktangitsut ilihimagit ka tabralu taitna mikironi inauralani taudung naktoktam na pilyaw taktangitsak tabralu taitna tamat koatit na taimahalarniaktot tangakun nagaluni tamat tumunam marahimatlukun tabra taitna taimahalarniakoting tamat koat ilat ni hapakralaktitakigait ilihakaniakaluaktot nutakaurat tabralu taitna munakri itna anniaktoalakitittak taitna tamat koatit na taaptiminga isagutit kagalawakitka taitna lu tabra ilokainikit na tap koat tabra taitna inuvialuktun niakayaktut nalupqirigi hiagutiraqiivuttait ikayorniaqaluarlugit illuatun ilangit kamakkiittaqiivut illuatun piniaqaluarlugit tabrakuat iñuvat na iñuuniartuat taapkuat 2024 25 munagilan tamatkoodi naisumaalugit katabra qanoq angalanniartilaakrangit mikiruani inaurani ingmiktigun havaalgit tabra tamatkoodi na mikiruanik iksaguti haqtuat uktoqartuat tamatkuninga ingmiktigun havaaqaqaniartuat ikayorlugit tabra tamatkuadi ilangit illuatun tainnaaullarikaming aul ingmiktigun havaangit na pillautaraariait tabra taapkuat GNWT tabra taitna itkugaluarneritka tamatkuat illuatun angalatsillat qiitkugaluarneritka taapkuat iluliqiruat taapkualu tabra taitna ilihaurartuat lutaqtat taapkuat tabra ilihallautaarming iñuuniaqaneq na aippaapak nakoorrimmigaat nakuuruakun na iñuunialaqarut tabralu taitna tamatkuat munaqiguptigit ilitsuariguptigit taitnaqano angalatsinikun tamat taitna iñuuniallautaqneq tabralu taitna tamatkuati naat avanmun qiniqqimalugutaamna anniartualeqisitigun qilarpak qaqtigi
Inuvik bootleg qallangnniartoq qiyanaq ikpakaraaqtaamna 24-25 tin maningnik qanoq havangniartuat tabra taaptuma itqagiluariga 2011-2017 taaptanu taapkuat oqororaanik havaktuat qanoq taapkuat qanoq havangniartuat oqororaanik taapkuat oqororaanik havaktuat taamna pipeline nik taihuga taapkuat Mackenzie Valley Highway taapkununa aulaniartoq taamna oqororaanik nuuttimmata qanoq taamna atoqugaat pipeline nik taihugaat qanorliqaatavra havaginartoq taamna 2021 taamna Mackenzie Delta liquefied natural gas nik taihugaat taamna oqororaq nunaptingni Mackenzie Valley mi qanoq taamna qanorliqaatavra havangnaqaluartoq taamna qanoq nakuoqqiniarlugit iñuhingit iñupta Russia tam na kanokle tabra okororonika haga gorok nunapting nun aglan tam na angbakpan tabra nakukinyak to ka inyuhek puta mani nunapting ni 26 million tam na kadok kanok tam na habaw takinyak pa yung nakuhinyak to kanyuhek put kanok lekha tabra tapkot tabra tam na to kuming tam na natural gas nakunyak to kanok lekha tabra okror nunak put okrorakak to kanok habaw takin right kanok tayo na nakukinyak to kanyuhek put tam na okrorak kun habang niyak pata kaya tapkot inyo tabra tapkot inyo hingit inyo tam na ay mabimni tabra ikayo nakirit tapkot inyo kanok lekha tabra inyo naktot nakukinyak luit kanok ikayo nakirit tapkot inyo uhima nunapting ni kanok inyo hingit nakukinyak tut kanok inyo hekput nakukinyak tuk kanok lekha tabra inyo hingit kanok inyo hingit tabra nakukigalok tuk aglan habang naktok kanok lekha tabra habang naktok habang naktut kanok tut kikanak lugi inyo hingit inyo tabra tok kanok tabra tapkot tok kanok umiyak pagpay taw lamata kanok nekha tapkot aulalay chit araki imakpud na himayak tugut tapda kanok tut kikanak kigalok tut kanok lekha habaw takinyak right tapkot kanok kakiharakun nagalunin tam na kakiharanik nagalunin telefonin kanok lekha tapkot automatic habang naktok tam na kanok lekha tam na fiber line nik tay huay tam na algorak pag nunapanda atani tabra kanok tam na nakugalok to kaglan kanok kava mabuta kanok habang nakigalok to tam na kanok algoranik habak to nunamatani fiber optic nik tay huay tapkot kanok tam napto kanok lekha tabra isok kanya nakalok to kanok habang mata tapkot kanok lekha ikayo naklugit inyo habak to mani kakiharanik habak to nagalunin talapokun kanok tapkot tabra Kanorleka tut kikarnearlugit Inuhivut tabra avakparaloartut ukuattaqa kanorleka tabra nakoqiniarlugit qanoq Inuhivut kanorleka aglan manitsugut tabra tabrani buni qanoqqoqariniar qalorikput taamna qanoq piniartuat havangniartuat qanorleqa qanoq qanorleqa havangniaraloortugut aglaan ilaani happerniaqqihuuloq qanoq havangniaqqapta tautsiukkun qanorleqa tabra ukuata havangniartuat qanorleqa tabra uvaguttaat minihitattaaqqaan tautsikkun havakkupta Inuhivut nakoqiniartuq ikaqqaarlugununaptingni qianaq Frame Lake qianaq Land and Water Board niktan tapkot qanoq nunaptingni nagalunin imakun havangniartuat taiku qianaq taiku tapkot havangmata Land and Water Board niktai tapkot nunaptingni nagalunin imakun havaktuat qanoq tapkot ukata havakparaqaloortut tapkot minitat nagalunin emalaittauq tautsikun havangnaqqirut ukata piñaq pipiarnaqrat recommendations niktaihuugait qianaq Frame Lake qianaq tapkot tautsikun qanoq kaninnaqqirut qanoq tapkot qanorleqa tutqikarniarlugit Inuhingit Inuit qianaq mi ICC miditaq qianaq taamna aglak niktabra qanoq Land and Water Board nin min qaitsirat taaptuminga aglangnik qanoq piniaqrat taamna pipiaqraq tapkot tangungitsot kavamalgi tapkot uqautiniaritka qanorleqa tapkununa qanoq tutqikarniarlugit qanorleqa taamna Land and Water Board nika uqaqiniarait qianaq tapkot minitat habang nekot tayo nako na tapkot tutkikarnek luit kanok tap kununa water land and water board ni kuyanak tam na kanorle katabra o kauchi o kaut o karigaloa tabra kanak tihulle ka o kautigaloa right aglan kanorle katabra o kautihu galoa gai tapkot kanorle katauchimun habang niya galoa gat aglan tabra pinyagat kilamit kuyanak tapkot kansanik tabra Inuit mani naglikaktut tapkot anya lutim tabra kanok ikayornak patigit tapkot health and social services nikta hugay tabna munakri inyungnik kuyanak tamna higangit chaklabin wiktun tapkot 811 tamdra kokoranak toka taimau kuvit higanik kanole katabra ikayornak luit taina pigalok tut aglan ila ni aperanyak kehurok tam naptok yal na primary care nik type ko kanolaka type ko time out kanolaka munari hugay type ko taina primary care mi time tabra munari hugay to ko type ko nut karnek tot higa nik taimakarnek tot higa nik 63 frontline workers nik tai hugay tapkot havaktit hivumi tapkot kuyanak Range Lake tamna kanok nidakat nakuarigat tamna kanoleka ikayornak lugitinit taina nutakat nakurivel lang nerat tamna kanoleka tabra ikayornak lugit nitakat nagalunin inyait iharming mi tabra taka Inuit himulika tabra ikayornak lugit higakun kanoleka higarnek higanik nutkaktit niak lugit init kanok nutakat nagalunin inyait humilika tabra ikayornak lugit tapkot nutakat Inuit kanoleka tapkot tapkot kanok ikayorne arugaitinit kanorleka ikayorne arugaitinit higa nik taimaarneartot kuyanak Range Lake kuyanak taiku ya taiku tabra dudakanik ikayorneartot kuyanak tapkot kanok tabra tipakunik kanok ikayorneapeaq right tapkot nitakat kanorleka higaarti nitqartiniarluit higaaruuruat qiyanak tapkot kanorleka taamna uvlakun world kanorleka tabra unnutqarniartuat higaartuat humiljaka nunaptingni naagaluunniin
that, you know, with the dope experience, that campaign that covers all different areas that is being offered within our schools. Thank you, Mr. Speaker.
Thank you, Minister of Health Services. Final supplementary. Member from Range Lake.
Range Lake okay tapkat kanok nutqarniartuat kanok ikayornearmatigit kanok akihuva kanok ukot tabra kanok ikayornearpatigit tapkot humiljaka habangniartuat
Minister of Health.
Una kehuniglaka ikayokti tabra ukot ila mikiroani inawarlani kanok allakayakini ilihimarunga habauttarik kangitamatkot tabalut tamatkot anniartualaqarit nagaluuniin matpat tutqikkaaniartuating mingnik tabra iloqaannik tabrani anniarvingmi munaqariruat tamatkuninga anniartualeqirit tabralum taaqtaitna kavamaurat iloqating taitna tamatkuat kiinauraqartut kiinaurani kiina atuuteqartut qiyanaqoqarti tabrauna tapkuap tabra tamatkuatina uvlutuaq tamatkuat munaqilaqapatigitinguit huna Inuvialuktun qiyanaqpak tabraptaq ikayuaqariat uvlutuaq tapkuaptaq taitna ilihimagivut tamatkuat kihut havaktipta ilihimagait kihut itna ikayorteqauktuat North Slaves, South Slaves iloqainnik taitna ilihimagait qiyanaqpak uqarti yalanavsantamit qiyanaq tabra qaffiñignik itna munaqari itna ikayorleq quruanik iñuiaktilaaqarpa tabra tabra uteruma taap ko te kautigin yelgin mitka uteruma taap tumunga tabra pinga yuatuna apasutara tabra na munakri rawakin na ilihaktoanik minihitangat yala na sentimin kulakrak tabra ukot tabra tait na tamat ko ta munakirat munakirat mat ko na tamat ko nga kanyararavat tait na hulaktoanik nagaluni kayo kalaw kuting tap ko nga ikayo'y huro nun. Yala na ignore me. Kaya nak. Unap tawak minihitamun tamat ko di na aglanik na taigo kaktok tuad ikayo ko na yakakabatigid ilihakamata. Tabal tak tayo na anyakabit na ikayo ko na yakakagait o kaktok tuad nagalunin tayo kaktok tuad tayo kamingin na hapakarak tuad tayo ko nimik. Mani yalo na ikmip tawak tayo na hekakpat. Tabal tayo na tinagalan abangok ang nakatam na ikayuirot kanok tamat ko di na hok tayo na ikayuinyak to at talimani ukiyo ni kanok tam na isang matiginyak parong kaya nakakakte tabra una ikakak laguno na kakpagput na tam na itok tabra lutay na miki na ikitut tamat ko di kayo kalakanyak to at tamat ko nga o kalay chonik nagalunin o kapkaktok tonik tayo kaktok tonik lo kaya nak tabra kapinyi ukiyo ni tabra lutay na kapinyi ukiyo ni tabra lutay na kanuhakakpat tap ko tap kuninga hawak takakpat huli tap kuninga atiruanik kaya nakpak alagingit pat hawak tingit kaya nakpak kaya nakakakte tabra na habakatigi bluit tamat ko di na isuatun inyuner kunin na inyuner lau tawag to di na ikayo ironik tamat kuninga tabra tawag tait na tabra ikakaklu man na nunap ting ni na pulak takak to kilitsaka niya ako ni kanok ang alaruti kramingnik. Tabra malongnik nutangnik habakti kramingnik 2024 minagilan tabra tamat ko nga tap kong nga habakta kramingnik habakta kaktut tabra na paksak kautigin may kakao na tabra na apakirta kanya kaya tugulik rangat tabra ko na ikit pain mata hawak tikrati kanolugit mat ko ilihakawing mi ikayo na akpatigit tabra tayo na ikayo na kitamat ko di kayo tikrangit ikaya taigua nikun nagalunin okanikun. Tabalu tamat kuninga pakamigut na kilamik aulak ti chukku fiti figi tabunga ikayok tauruanun takpabunga tamat kuninga na ilyakhe himarugut hungit kibut tabunga aulak ti takpata ilitsore tamat kuninga ikayok kubulugit ilitsore kubulugit kanok mane inyugak tilangit okalay chot nagalunin taigok kak doktor. Tabalu tay na yellow night mi ilihaktot alalu tay na tamat ko aptaring miktiguni na Inuit naluruat Inuit na nalukak tilugi na ingmiktigun tay na habagak tuati na irak tua ribluting tay na ingmiktigun tau haba pakit sila kay batay na ikayok tiksanik. Tabalu tay naptau ilihimagibutin na ingmiktigun aulak sila kaktot. Kanakulu tabatay na inauraming niya kanok angalan ningat ilitsure himagibut. Tay na luptok tabat na tabak na kimilreo kimariga ilitsure niya piaklu kanok angalat sihum magay tay na inawalani sa tumin. Kaya na ko kakti tabra ako pakutake o kakadjakaka tabalu tay na kanok nunakput angalat sakay waso tamne isisimin tapkot isisimin na tamat kuninga kautilabang nunaniglo nagarutiniglo munak minihitangata tabalu na kilamakirungit sugut tap tuminga kinatagarirugut tap tamat kodit na horakautik rakalawabot kabamat o kakatiya kanagit nagalunin alat mat kodit nyutilihimarot tamat kuninga o kakatiya kanagit tam na isaguti rakalay kikput. Kanakula o kauta kanagit. Tap timuna hinakun alangok taktom. Tabab August me o kauti mikara na aparutake mikara. Tabab tay na tam na isagutingi hangat. Taman na aparutake kapku tam na hok hibuhuba aparutake tam na. Kaya na ko kakti. Tabarukot ilihimarot tamat kununa nunanik ilihimarot kanok angalarutinginik tapkot o kakatiya kanagit tamat kot na nunanik na munakrirot tamat ko imakun munakrirot tamat kot na apekra kanagit nagalunin ilitsarap ka kanagit kanokin nektilak taman na kuyanak sa tumin. Kuyanak wakakti. Pingayot ako na apakiltangat. Kakugutam na pianing niyak parung apakiltaka. Kuyanak wakakti. Tamat ko tabra. Kanak tamat angalat chimmagaita munakriroat nunanik. Tamat kuningalo kanok angalat chihum magaita. Kanok angala rutinga dilitra kanago kanoheralay chugut. Tabra 2024 mi umani pinakakpaong ilitra beak tugut. Kuyanak. Okay.
Complimentary, thanks very much there.
Taiku kiu kam nga. Ni taktap tu munakri makaming. Kanok pinyakpat. Nini taktam na kanok hilakput munakri. Tap ko kanok kanok tauchikun habakkalok. Habakkalok putaglan okarinak toka humilaka kihun laka tabra tauchikun habang niakaloarat. Kuyanak. Kuyanak. Tam na dumpster highway up kodakpak NWT mi. Tabra tap kat up kodakpak ilan ni nit kaurutak again araki tabra tap kat nit kaurutak tap kat karu gai tap na. Oh God. Too fast. Kanokle katut kikarniaraloaga itap kot about tarniaraloaga itaglan ila ni haparanaktok. Kalau tinerat kat emelate tabra habang tap kot kanok tap kot ap kodak pait kanok nut karor aglan tap kot imakun aulamata kanok pinyak patut kikarniak parung kuyanak. Tautul lagi ta aglan okailag nerit kapta kihulaka akauchinerit ka okak tauchikun habang nerit put kuyanak. Tap kot up kodak pait around Wrangling River mi tam na kanok tam na tap kot kanok исоққиниарпарун таамна апқутеқпак илангатаан атулқунайтсеқ куянақ таапкуат апқутеқпайтут tutqikkaarneeraloaraita Yukon taapkuattauqa Yukonmi havauttarinaqaita taapkuat Mackenzie NWT tauqa taapkuat tautsikun havangniaraa taamna tutqikkaarnearlugu taamna Wrangling Rivermi apqutak nakungitsaaq qiyanaq Mackenzie Delta qiyanaq tabna qanaq ikayullavigita taapkuatiñuita qanaq taapkuat taapkuat ikayullavigit taapna apqutarpait sigitsikmi Fort McPherson mi taaq taapna ikayullavigit taapkuat humi taapkuat qanaq ikayut quvio taapkuat qanaq apquteqpait nakungitkaluartut aglaan humi taamna havangitpa qanaq Trinity Walde taapkuat iliharvingmi taamna iliharti qanaq qanaquniarparung taamna taimaaqtuaq qanaq taapkuat qiyanaq taapkuat qanaqleqaatavra taapkuat iliharaniartuat tavra haperniaqqipiallakkaluartu qanaq inni taapkuat nutaqqat iliharaniartuat tavra we've got April 2 to qanaqqa taimaaqpata skoorvik tabra hupkuangita hupkuarpata qanaqqa ikayorniarpati taapkuat nutaqqat iliharaniartuat Lutsal Kemi qiyanaq ECE taapkuat qanaqqa ikayorniarugaita qanaqleqa iliharaniq ilihartinik piñaarlugitna qanaqleqa ikayorniarlugit taapkuat tavra ilihartit tavra piñaaraluarait tavra ilaani pirniaqqihuuruq qanaqqa qainiartuat ukut nuun matamaunga qanaqleqa tavra tapkot ilyak tapkot ilihaqtuat nagalunin
that they live in. Thank you.
Minister of Education, Culture, Employment. Oral questions, member for Trinidad Willoughby.
Trinidad Willoughby. Tapkot ilihaqaniaqtuat qanoq piniaqpat isi kayullavat tapkot nutaqqanik luutsalkeemi ilihauritsuat tabra 24-25 ilihaqmata tabrat ilihaurimik piqaqtut tabra aulaqanaqqaluaqtuq nutaqqat aulalarut tapkut skuuriaq ilihaaqiarniarluting tabra aglaan angiyoqaangit pitqungitkait qiyanaq tapkot adult education tapkot inyanik ilihaurirot qanoqniaqpatung tamna isiini qiyanaq tapkot Aurora College Aurora College tapra pillar kalwaq gai tapkot qanoq qauchinaqtuq qautivlugi tapkot Aurora College mikat tapkot social services mini taqtaamna qanoq tapkot aillavat tapkot taktiliaqtuat qanoq taapani haaruk ittuat tapkot ikayulaitkait tapkot qanoq ikaqqaarlugununaptingni tabra ikayulaitkait tapkot qanoq taaktiliaqtuat haaspilmiittuallunni anniarmingmiittuat tauna qanoq tapkot qanoq anniarmingmiitsuat qanoq ikayullavigit qanoqniarpatigit tapkot taaktiliaqtuat naakalunin anniarmingmiitsuat taamalihaaraluk qanoq ikayullavigit tabra qanoqliqa tabra taavani haaruk anniarmingmiit tuat kiñarukun lihallarut hi qanoq ikayorniaq ikayulla ikayullavait tapkot inuit anniarmingmiittuat qanoqliqa tabra ikayorugaluaqaita aglaan kiñarukun ilitsoqinartoq qiyanaq qanoq kanok tap got inuit manga kanok anerving mung pat taina tabani hatabung haruk kanok ikayulla vigit kuyanak ukat manga aulak pat kanok anerving mun tabani hatabung haruk kanok tap got kanok healthcare insurance niktay hugay tap got kanok pigaloagay taglan ni ukat kanok hikayo bugaloagay taglan tamna pek pipiarnak tok tamna insurance nik tay hugay tap got kanok maperak tamna ikayornak kuyanak ukat kanok tap got nyit mang nalurut kanok nek patap got anerving muk patatam haruk tabung haruk kanok ikayulla vigit tamna malerotaliok kaktu tabra tap kununa havagurut tap got medical travel miktay ugay aulamata taktilearmata tabung haruk kanole katabra habang nakaloaktok ta aglan tamna aulakamata tap got tautung naktut kanoka ikayo hikayokleriurut taina tap kununa kakeharakun tautung naktut kuyanak Yellowknife Center kuyanak tamna premier kalklik aperture lang diaria tap got kai pa kama tabra kai kami manga kanok tap got kanok tap got habang nekpat kanok kalklik na kilang nektok kuyanak tamna malerotaliok tamna pichok pingichok taina kanok tap got kanok okakamata taina okakamata tap got havaguro taina habang matatay na tap got habang matatay na pinyakalaktot aglan iyan ni haperanyak kahurt kanok kanoklekai kayorniarlugit inuit maani nunaptingni ikaaqqaarlugu nunakput kuyanak tapkut tapkut qallik qallanniartoq minitat ta ilihimarut qanoqqa havangnartoq maani igloqpaqparmi tapkut 14-15 tunham inuit tamanit maani havaktot
Cabinet.
Uvani ikit pailiuta minihitat MLA na angirot tun ineriluta na aperluta karanearufi na katimakapta tivani aperluta rahi ilitsurepkallakayari tigut taimahin kigutikshaptingnik ilhimaluta kanokkiuniaq tilaaksarpi kia hunik tabra aperluta kauming hungin miivut kuyanak Yellowknife Centermin kuyanak tabraptauqit na taimaaqti taqalugit naagaluun ninnut qaqti taqalugit matkuat aperluutavut pitqungit kaluarneritka uqaqti tabralutait na matkuat kavamauruat na tabralutait na hinik matkuat minihitauruatit na naagaartullavat hunnik apeqeruaqautiptingniit tabruna ilitserepkallaqugaluarnequnga qanuherautiksangini tabralutait na ingmikti uaptiguni na uumikkutiluta naagaluunniin huinni pilaitsutiera uaptikkun taitnainiritsoq una tabra upagutit na MLA-guruat naagaluunniin minihitanun apeqeruuttaqaruming tabra qano apeqeruuttahi naitqugitka raangitkitka aglaan aqulliksaquna apeqeruuttaksranga kuyanak
Thank you. Member from Range Lake.
Mr. Speaker, my questions are for the Minister of Health and Social Services. How many agency nurse contracts have been utilized since 2021 by individual nurse? How many agency nurse contracts have been utilized since 2021 by...
Tapgot agency nurses miktai hugay tapgot nurse tabak dot ingmingnik. Kanok ta kanutun tapgot agency nurses nika coffee ta habak dot in 2021 mi. Hindi ako na maning nika monakrihurak tapgot 2023 mnin tapgot hilyakanyarit ka tapgot kanaklaka. Illness Center. Tapgot ilyakalang narit ka kanok tapgot kanok. Tap ubang ilyakalang narit nga speaker okakti. Pampuimino kalang naktok. Tapgot tapgot itkarin lang narit kan inyay tapgot tabra ta noon narit ka tabra tapgot kanok tutkikanak tutapgot kanok inyay munariniaklugit tapgot kanok tapgot tapgot inyay 60 years and hippalgit kanok kanok lekata tutkikanak tapgot inyay ikayaklugit tapgot haperanyak roka inyuhingit tapgot tapgot inyay kanok got inyay tabra kanok leka inyunyak tuta inyay tabra ikayonak kigalok tut Range Lake June 5 ugat kanok okot kanoka nunani manin atoktot kanoka akilirneartot kanok kanoka piniarpatapkot inuit atoktot nunanik kotauka kanoka kanoka atoktot nunanik piniarpat kanoka akilirnearpat Hipanik 120 Dayton, Uvluni, 120 Uvluni, Pinyak.
On Wednesday, June 5th, 2024, I will move the following motion. Now, therefore, I move, second by the member from Yonge North, that the government of the Northwest Territories immediately provide funding grants to Indigenous governments that wish to complete home inspections in their region. And further, that the government of the Northwest Territories provide financial support to Indigenous governments to assist in data collection to support opportunities to leverage federal government funding. And furthermore, that the government of the Northwest Territories provide the funding to secure sustainable financial resources for housing programs and projects. And furthermore, to facilitate this financial support, the government of Northwest Territories enter into a memorandum of understanding with all interested Indigenous governments and bring forward a necessary appropriation by the end of the 2024-25 fiscal year. And furthermore, that the government of the Northwest Territories respond to this motion within 120 days. Thank you, Mr. Speaker.
Thank you, Member for Trinidad-Willity. Notice of motions, notice of motions. Motions, member from Yonge Centre.
Thank you, Mr. Speaker. Whereas Section 16, brackets 2 of the Human Rights Act provides that the Northwest Territories Human Rights Commission is comprised of such members between 3 and 5 in number, as may be appointed by the Commissioner on the recommendation of the Legislative Assembly, and whereas there will be 3 vacancies on the NWT Human Rights Commission as of June 8, 2024, now therefore I move, seconded by the Honourable Member for Cam Lake, that the Legislative Assembly recommend the reappointment of the following individuals to the Northwest Territories Human Rights Commission: Ms. Marion Burles of the town of Fort Smith for a term of 4 years, and Mr. Charles Dent of the city of Yellowknife for a term of 4 years, and further that the Speaker be authorized to communicate the effective date of these appointments to the Commissioner. Thank you, Mr. Speaker.
Thank you. Member from Yonge Centre. Motions in order. To the motion. Question has been called. All those in favor? Opposed? Abstained? Motion passed. Motions. Motions. Notice of motions for the first reading of bills. Notices of motions for first reading of bills. First reading of bills. First reading of bills. Second reading of bills. Second reading of bills. Colleagues, by the authority given to me as Speaker under Rule 2.2 brackets 4, I hereby authorize the House to sit beyond the daily hours of adjournment to consider the business of the House. Consideration in Committee of the Whole and Whole of Bills and other matters. Minister Statement 4-20 brackets 1, Minister Statement 5-20 brackets 1, Minister Statement 17-20 brackets 1, Minister Statement 24-20 brackets 1, Table Documents 93-20 brackets 1, with the member from Trinidad-Willity in the chair.
Trinidad-Willity min kapal lang niyaktok. Una kaya kamal lang niyaka okakte.
My coffee.
I now call the Committee of the Whole to order.
Ukotavra atauchikun ilakaini kataulukitwani okauti kraming okakak koming okanak 2024, 25 tamat kot ilirakrangit hiwunneotikrangit ilakarik tavra koyainak parong tamna tavra kot 92-20 ukat okakitaktichirot minitangat munakaringat minitangat nakabingyundang naktok tabrona maunga rihuk pa ikayok tikraminyik isiw rihuk pa ukaktane pelak. Huh?
Thank you. Would the Minister please introduce his witnesses, please?
Ukotavra tapko tavra kuaka ikayok tingik isiutigaik tavra kot apakautakakpat 308 mi apakautakakpat taptamani makparani tomi kayanak frame laking mulang yaktama kayanak okakte tamna tabra apakautakaktu taptamani tabra allangonangin paung tamna tabralu ukot 306 mi makperani tautung naktuak na malautaliu kangat tapko tabratai na agichuti labarung tamna ukauti kan tai naptok tamara iliakirangit na kamakichiwatigi na itoakiwatigi taptamani makperani itoami tabraptok tai na allangonangit pasung tamna agalaktangat na manitamin minitamun okauti falakhuikia tamna tabra malakotaliat tabra nitut 2024 min tautung nachok tabra lutai nachonagalan na uktorautingat ja uktorautigikkangat kuyanak frame lake min kuyanak wakakte akapiri tamna tafra apakautigillang neriga tafra na angimman pirakrak luni tay nakuting tafra tamna kigutiksaitsungnaktut kuyanak wakakte tafra na apakautigillang nerigona tamna tafra umikkarmarrung tamna isaqtaavik Portsmouth mi tafra na umingniaqput 32 luni tafra ni havaktot tafra havaakreaqiliitsut tafra na minhita muuma uqautigi faallalam lavaung tamna Portsmouth mi umingniakkangat isaqtaavik natunagala havaktaqartoaq havaktittaapkua hulaqaarniartilaaksangit ilitseqillaruk kitka tamna tafra illuatun pigitkup illuatun pigufiung tamna tai naittuaqiloq agilaan uqautigi faallau quvlugupiga tafra una qilamik naagaluunin qanuq naagaertorlugu angaralugu tamna illuatun kigutikseraq haperiñapiartoq tafra iloqata taitna havaqatigiitupagut taitna tafra taapkuati ikayoorlugit issamuagipiarivut taapkuallu kavamauruat maani iliguvlugil taitnalum tafra taitnatunagalaan inna amaleguruartaavanga sabbatical min tafra tamatkuati taitna issummatigigaаттauq
a bit of a plan to move forward.
Tamnalu tafra taitna hivunniortiksraptingnik isimaaluktuguttauq ataramik taitna ukiuttuarman taitna tallimaniyuni ukiuni tafra tamna uqautigi himmarmikkarput tamna tafra qanuq havakteqartuaq taitna tunagalaan tamna isaqtauvik 228 tabrani isaqtaamaruat tabra qanutunagalaan kiiñauranik atoqaniartilaaksraptignikit na hapeqraqtugut taaptuminga angalaikikput taaptumuna qanuq isummatigiiqqaarlugu naagaluunin hivunniorutigiqqaarlugu taamna tabra qanuheraarniangikkikput qiyanaqoqarti qiyanaqaqappili tabrauna hapeqinaqalaartoq taamna qanuq angalanniarutiksraq naagaluunin angaarlugu illuatun taamna pigufiung nakunayartoq tabalutai na anmuktut tap ko isak tao marot hibi nag inyuga ngitsit ingilagatun tabaluptak na kabamauroti na kanokulugitit na ingmiktigun tam na ahibun niyo ko tigilugu pinyangit kat kuyanak tain na ko tataba unupani tain na isumatigi miikput South Mackenzie takpavanaramiut maani nunaptingni South Mackenzie mnik pidaragait tabalutai ni tamna umekungit kalokkan tauqilingita tabalut tamat kooti na ilihimabluting tait na piaqluk taqaniartuat tait na nigaluarving tabranga aglan ikayutikranginnik piigumangitsugut ili tamat koot iliraqaanikkamut ikayoquvlugit kavamauruagut luupagut taitna tabra tamna isaqtauvigit na umik tait naqaruinnarpingit kikput pinyaangit kikput illuatun tait na havauttaqi raqraq piigumanaangit kikput tamna ingilaqaan tabra tait naqqimagaluartuat tabralu tait na inugiaktuatit na ingmingyun havagukutinglu tabraptaaq tait na ikpakraq tabralu tait na ilihimarugut tamatkuatit na tuniuqqaayaqtaqtuat maunga nunaptingnun tabra tamatkuati sumalugimmiivut pangmapak oqautigillagukkikka qanuq tabrailoqating tamatkuatit na 32 tabrani havaktitit na ilangitimma havangaillagukuting isumavaat naagaluunniit ilitsoqillaugun qinnarlunga huniartilaakrangинник taapkuat piunga nanilu ikayorniarpihigi allanun havangniartuat allanun havagiarniartuat ikayorivitigi tait na allanun havagiarpataa qiyanak qiyanak tabrahuli Fort Smith mi aqanat isaqtaavingat ittoqhuli tabrani maaniptauq na isaqtaavaqarmiut maani nunaptingni Yellowknife taitna tauq 30% tun tauq havaktaqarmiut tabrani tabraptaaq tamatkuati na angmaqqimakivut umittaqaniagitkivutukuat hitna allanun havagvingnun pillagivut taapkua havaktuat satumin qiyanak havak oqaqte tabraptaaq taamna itaitna isummatigiñaqapkui quyagimmiiga nakuaqimmiiga taamna taitnalu taaptumanga havagavingannin allamon havagwingmun ilillani mau kuyagiga tait na tabra tamat kodin na namon nutsuktot ikayullagupki kuyanak tunga nakwakanyaki kuyanakpak Range Lake min kuyanak una tabra Fort Smith min umingniak kanga tam na isaktawik kanok ikayutiginyak parung tamatkot kanok ikayutiginyak parung igilungat iningat tabra na isaktawik na kanok tam na alang kanok na tutkikalugu atohra wa tabra nalurugut huli kanuhunak tilagraptingnik tabra lutai na kanok atohna ni blue pigaloga tamatkot tabra ni Fort Smith Meat Inuit tabra lutai na mani hibunnioktit Inuvialuktun 22 kiaktamani na isuatun inunearneartut oqaqteqarmiutai na hinikinyungnik ikayuuruat isuatun inunearnear kun piniartuat taina hinik ikayoktiksanik igilunik taina oqaqtinik iñoqartoq taina tamatkodu pallaarasagit igiloqarniarpaat tamna tabra umikkumissuung tamatkot kavamattit na ikayutauniarpaa huoqtait naqaniarpisiung tamna tabaktar tamna na isummatigikaptigu kanok tamatkuatit na akihuruatit nappaqhimammata himmauherniarpigit tamna tabrani uvani malaqutaliani ineritsortaanna kuyanak
Thank you, Mr. Chair. So
Range Lake mina oqallagniartuq oqaffaaqniartuq qanoqqaataapkuat qanoqtaapkuat tutqikkaqarniarpatigit taapkuat upkuartuat upkuarman taamna isiqtaavik qanoqqa avagniarpat avauttariниарпалу qanoq Range Lake qanutun taapkuat atorniarpatigit taapkunanik piniarluting wellness camp taina pihugait taapkuat qanoqqa tutqikkaqarniartuat innuit iliminik qanoqqa nakuqqiniaq kangit ta innuhingit qayanaq qanoqqa taapkuat pingitsoquli qanoqqa qanorniarpatigit taapkuat qanoqqa pinyak kanok habang niyak parang tamna kanok humung niyak tap ko habak to tain tamani kanok iswa kanyak parang kanok Inuit tap ko habang niyak tot tamna minditak maning nika munakre tabra kiulagatin tap tama minitam tap tama maning nik munakre Range Lake Koyanak Taiku Techomin Koyanak Tapkot kabamat kanalaka habaw takinyak parang tamna upkwak tak sektavik Koyanak tamna upkwak tak kadok kanok tapkot habang niyak parang kanok tutkikak niyak parang tamna kanok tapkot habang ayak mata kunak kanok tapkot tawk akanat isik tawk bingan tamna Fort Smith mitok kanok akanat isik tawrat angirok tamna kanok Inuit kanok lekatut kikakne akalawakait tabra kanok iswa kanyaklu tamna kanok 25 tapkot 25 ten habangay kalut Inuit tabra kanok niyak parang kanok tamna upkok nakhigat tamna tapkot nutak kanak pi munakrirot kanok tapkot kanok kanok habang takinak parang tapkot tamna kanok tutkikaknak parang habang kalok tuwit kantain nakokinyak luwi kanok munayanyak luwi Inuit tabra taimak tot habang itchot kayanak Great Slave kayanak tapot munakrit kanok corrections nagtay hugat time na kanok munakrit kanok isik tawronik kayanak EIA or Justice Minister tabna kiulang niyak tapkot kanok tapkot
facilities. That is one of the issues. Perhaps I can hand to the Deputy Minister for some more detail on this. Thank you.
Thank you. Thank you. I'm going to go to the Deputy Minister.
Thank you, Mr. Chair. Yes, those are two reasons we suspect. We currently have a senior management working group looking into this. Our numbers have decreased in our facilities significantly.
Okota kanoka 2020 mi tap kota haba kanok habang niak kanok pinyak patut kikarniak parung kanok tap kot habang it shot tabra kanok tap kot kanok tap kot tut kikarniak pating tap kot habang tot nagalunin kanok niak kangi tap kot isek tot great slave kayanak Ukota kanok tap kot habang mata pip karnak luita tap kot inawer kanok pinyak parung tap kot kanok Inuit tabra tap kot kanok tut kikarniak pati tap kot kanok isek taurot nagalunin inyurot nakung chumik kayanak great slave kayanak thank you Inuvialuktun Tamna Fort Smith mi isek tawik kanok upkuangidik tot habangit chutuli tap kot kanok nak pating tamna Fort Smith mi tamna tap kot upkuangidik ganik tot kanok tap kot ikakaklugu nunak po tap kot 44% tun hamma itkalok to tap kot pinyak pat kanok pinyak tot habang niak tot kanok tap Fort Smith mi hamma tam na isyak tawik ganik tot kanok yal naif mi tabra tap kot habang niak tot isyak tawik mi kanok niak pat Inuvialuktun kayanak tap kot kanok habak tot miksirut kanok niak tot itkagiba tuna kanok leka tut kikarniak lugit habak tot икаёрниарлугит таапкуат тавра упгаарлугит ялнайф ми таапкуат миклилугу таамна Fort Smith ми ohima Fort Smith mi taamna исертауика ааммартиллугу Inuvialuktun taamna tauto itqaginiaq itqagi qianaq taiku YK Center. Humitapkuat havangayarniarpat taamani Fort Smith mi. Huniarpat. Havangayarniarpat huniarpat. Kuat humi tavra tutqikarniarparung taina qanok qano tainarmata tapkuat 3 months 3 tatqiquni pingahuni tavra kai pingahuni tavra ilitsoriniangitsut aannapak ukuat tavra nakungit kaloqtoq qanoq taapkuat havangayarniartuat qanoq itqagihinniarlugit itqagisinniarlugit tavra oqarigia qianaq tavra qanoq piniarpat tavra nappaqaniarparung healing center miktaihuugait tutqikarniarlugit Inuit ingmingnik ingminging inuhingit qanoq taamna taapkuat inuniartuat tutqikarniarlugit inuhingit qanoq taamna wellness center miktaihuugaat taamna apeqrornaq taamna miniitaq qanoqniarpat qianaq tavra nakuarigit kataamna oqarman qianaq Young Life Center qianaq taapkuat qanoqniarpat illuaqqiniarparung qanoq tainarmata havangmata taina taapkuat tauqa Hey River taamna iseqtauik qanoqniarparung taamna Hey River mi qianaq qianaq havauttarigaluaraat taapkuat qanoq Kaloka tutki karniakluita kanorleka tamna government Portsmouth me. Tap good kanoka tap good pilginya tap good isaktau gad kaloka aglan kanokumnya remanded miktai hugai taina isaktau ngilinya kot. Kanoka tap good havangak tilugit tap good.
I recognize that government has to do the government of business sometimes, and I would encourage the department and the minister to use the fulsome opportunity of trying to find ways to bridge these into the other two facilities, be it Hay River or Yellowknife, or find some ways. I do know that the Yellowknife facility has challenges, staffing, overtime, etc. There may be opportunities. You folks know your numbers better than I do, so I know them anecdotally, but you know them. Support to find ways. I'll certainly be supportive of finding ways to get the people to facilities that could use them, and if that specific line item needed to be a sub for transfer or whatnot, I mean, I would easily be supportive of that. Thank you.
Thank you. No further questions? I will see none. I'll continue on. Please turn to page 307. Justice Corrections Operation Expenditure Summary 2024-2025 main estimates, $36,757,000. Does the committee agree? Could, if you could say it louder so we could hear it. Thank you. I'll read this out again, and if you could speak up. So.
Tap good kanok munakrit hisaktoronic kanok $36,757,000 in atulginyakot adonelinyakot. Apekrohik patinuit amalate nami.
$25 main estimates, $15,765,000. Does the committee agree? Thank you. Moving on to the legal and services beginning on page 313 with the information item on page
315 mi tabratamkat pakanyari Yellowknife North Min apakrutakaktok. Kaya tabrokot imagtunga. Kanok
vulnerable people in our communities. And decisions that are made for them are supposed to be based on their best interests, on their views and preferences, when that can be determined.
Tam na tabrapigo ma kanok hibunakakpihitap tumuna. Tabra $300,000 tun tam na anmukta na yakat kinyarak. Tabra lutait na 25,000 to nalak huna tap kog nalap ki accounting. Kuyanak. Tap ko tabra Inuit habang nektot habakak tot tap tuminga anmukta nelikat kinyarak. 7 lawyer road tabra Inuvialuktun loya kallarartut nutaqarinin naagaluuniin Inuit kihiming tigun tamat kuninga loya kharu tamat koruoqi ikislilaaligan niarlikkait kiinyaurangit taamna tabra nalliingit havaatigun pierniarpitigit tabra taamna ikuatun piigin aperruuttaqin tamat nutaqqati uqaqqitaartuattauq loya kharumiut tamat kuat piiaranaalikkait taitna tabra malruuluk taitna loya rookitna ikajorlaqiniartuat uqaqqitaartuanik tabra taapkuak isummatigiliginneqaik atauhinngoruglugu tabra luut taapkuakitna ikajorlertuat uqaqqitaartuanik loyanik pihiaguait tabra taapkuak nalliikuarpihi taamna qutsilqaartuaq loyaruaq naagaluuniin unatuglea ikayuiruat tamatkuat uqaqqitaartuanik tabra nutaqqattauqitna ingmiktigun isumaqaramiut isumangitigun aulallaruhi tabra taitna nallikuarpihi taapkunnuuna uqaqqitaartuni ikayuihuuruat loyanik pilaqigait tabra ikayuinagutiliginniarpat taapkuat nalliingit tabra taitna tabra itna hapeqraaruuting taitna tamatkuat atullaaniaqait naagaluuniin itna tabra tamatkuat itna munaqriruat taitna tamatkuninga itna ikayuartinin uqaqqitaarmata qanuqqit tamatkuak taapkuak itna nalliikuarpihi tabrauna kangeqqipiarluguuna pihukkaluariga tabra kuat aperruuttangit tabra ilihimarugut inuiak tilaangit maani itna ikajorlertuat uqaqqitaartuanik loyanik pihugait tabra taitna qutsiktuani itna loyaqartut matkualu pillugaalaruat itna allagiiktut tamatkuat loyaruat itna ikajorlertuat itna uqaqqitaarmata tabra kangeqqikama tamatkuat itna uqaqqitaartitsirit tamatkualu uqaqqitaartuanik munaqringit sisamanik loyaqartut uqaqqitaarmata Inuit itna ikayuutaqartut sisamatun tabra taitna tamatkuat itna munaqrihuuruat tamatkuninga uqaqqitaartakranik itna munaqrihuuruat legal naitniks pilaqigait uqaqqitaarniartuat munaqrihuugait ingmiktauqitna ikajortisranginnik taitna isumaalleqartut tabra tamatkuat nutaqaranik ikajorleqaniangitsut tabra taitna piaqluktaqtuat taitna ikayuqleqartut ikayuqtimik uuminga oqaqqitaaqaming ikayuqteqartut tamatkuat piaqluktaqtuat аллагиттутагалаантуи таитна икайортингит итна оқаққитаартуни таврауна илихимавитса таматкуатитна пиартуни итна хаваангит таитна химмаухиллавихиги таврауну таққат нутаққатин наоқаққитаарпатай на икайортингит
this office together.
таинналу таматкуатитна илахаутиллавихигит таинна икайортиксрангит на оққитаартуани илихаури хемавихи Manilu Alberta mi. Manilu Alberta milu. Taberta matkodi na ataut chimiti tarigait. Tap kuninga tay na hakpihi. Tamatkolo tay na habak to ako ting tay na ilinya ako ting ikayok niya nimik yukakitaktuanik loyanik pirarigait. Kaya na. Range Lake min. Kaya na ko kakti. Tabraw na kang hupiaria. Tamat ko dit na munakrirot tayo na isak ukakitaktuanik. Kaya na. Bangkok muna cube ka lang niya. Kaya na. Tawa ukwat. Tawa tamat ko din na tamat ko ikayo niyaktuat. Inuvialuktun na tamat ko nga ilyakilaru tamat ikayoktikrangin. 22 to 23 mun 9 million to tabad atokne ni bigay 25 million tayo na ito naglaan atokne aktilaka na doon na ilitsura hemagiga kanoro ko at tabraw na kanok atokne aktilaka na ilitsura liyaw kulunga piyunga director mo kaya na tabraw ko at tabraw tayo na yung mitigun tamat ko at ikayok takarorot Prince Lake min kaya na tabraw na nakoma tabraw tamat ko at na yung mitigun ikayok lakanyak to nagpakaroming akihulkak patap ko nga ingmik na inuit ay chungit pating ikayok tikramit. Kabamanin ikayok tikarorit tamat ko nga loya ni kuyanakpak.
Thank you.
Mampuy minu kalang nektok. Apikroy lang nektok. Tap ko ukakitak mata. Kanok. 2023 tam na tap ko kanok habang niyak parang tayo na 24, 25 din tabra ni ukini iklinak to ko dam na children's law nik tai huga tam na nutakanik munakrita lawyers. Lawyer nik tai hugait munakrita nutakanik. Iswamika inyu nyip karneakluita nutakat. Minihidak tamna. Bancroft minka tamna kiunaktak. Kuyanak. Tap got federal government 1,072,000. Tap got munakri kaming nutakanik. Tap got lawyers niktai hugay tap tuma pinyakok. Kuyanak. Tap got kakdakmata. Tap got munakri hurot wakakdakmata tabra munakrit. Pichut tain na hinika habaktonik tap klitomi. Ho kabangit patay na. Habakangit patay na. Klitomi. Tapgot pingaw ni inarani. Court services tam na munakrita utaketag mata. Tapgot yellow knife mitut tapgot humilaka in moving me here me yellow knife me tapgot court worker niktai hugay tapgot ikayoktet inyong nik kanok wakaketag mata. (2024-25) tapgot atolinyakot atonaktot maningnik. Inuvialuktun Lake min ukarnaktok. Tapgot tamna nakunak hok pinyagat.
(2024-2025) main estimates legal services deferred. We will now move to the next key activity. Thank you. Moving on to the Office of the Regulator of Oil and Gas Operation on page 316 with information item on page 318. Are there any questions? I'm going to go to the member from Yellowknife North.
Thank you, Mr. Chair. So when I was looking through the annual report, the last available annual report for the Office of the Regulator of Oil and Gas Operations, it clarified that we don't have any active oil and gas operations in the territory. And to be clear, this
Hukwata ISR Inuvialuktun Settlement Region na kanok. Tapgot Norman Wells tauka tapgot habangin niya kotay na 22-23 tapgot okroronik ni baktit nagalunin habaktot na tabani okroronik ukot kanok minitat ukaribadrung kanok pinyakpat. Kanok tapkot ukurani kavaktot Norman Wellsme. Tapkot oil and gas inarangi the tabra. Kanok havaktot na tautuk tongit kitka. Hilihemangit kitka tapkot havaktot taina. Ukot kanok about the hita next. Ukiut king mi tap got hakuta kanerit about the nerit havang nerit taina tap got ukif kego kuyanak. Itabra kangi kega kanok tap got havang nertot. Tap got manik atok na nakunakot kadok. Kanok atong matatay na maning ni kanok nakuva na nagaluni ng kanokit pa. Minitak tabra kanok maning ni pachitik tay hugay tapot maning ni katuktot nagalunin atokinchot tautuk to neriya kuyanak. Kuyanak.
Thank you. I'm going to go to the member from the Satu.
Thank you, Mr. Chair. I kind of view
Kuyanak ukakte. Ukot kanok. Tapot kanok.
royalties received by this industry. I think I don't have the numbers in front of me, but it's into the millions. So if you're spending 1.2 million and you're getting back royalties and
Ato na koktap tayo na hinitun maning nik 1.2 million tun kanok kanok tap got kanok tap got kamiloy nakigay tap got nyuita kanok dam na manik ato atulgin niya kay tap got kanok manit kanok 627 million tun hama kanok dam na Norman Wells ni ukorora ni habak tabra tay na piliin niya kok. Devin Canada ingilakan tam na pihut kangat na Ublupakay ISR angalan nirat. Tabra kanok about tarigalarat aglan tapkot satu kanok about tarimadung Wangaptak habaktonga tapkot Kemilirunigait tapkot kanok okroranika nibaktot kanok habang niya kangat kanok tamna pinginyakok taymarna kok tamna tapkot tautuk kalwarait ilitsarin lang niyaray taptukot kanok kanutun nibangniaktot kanutun nibakrat samsnik tayo hugay tukot kanok about taraniak padig tapkot tapkot kanok nakuarinirat ka tapkot habaktot kanok tayna pinyaktot apekrol lang niyarga pinyakpat kanok tautikun hawalavat kot satu mini daktak tamna haba tapkot kanok inglaran tamna ilihimagia kanok tapkot nibaktot okroranik kanok tamna habang matatay na tapkot tamna tapkunanik kiunengit kiga habang itsungatay na kuyanak tapkot Imperial Oil ingilyakan tayo na habak kaloktot tapkot habang matatabra kanoklika iktay hurot kanok iktay hurot na kurokan kanok munarahugay tapkot iktay rot Imperial Oil niktay huga tamna okorokoronika nibang niaktot habaktot tayo na iktanik tabra kanok tapkot pinyak parung kauniginiak parung tapkot iktanik pirot iktanik iktayrot tapkot halum manaktut halum makinaktut halum makinyagalwaktut tapkot iktayrot tapkot tabra tapkot habaktot tayo na okororanik nibaktot tabra kanok pinyakigalwa pinyagalwaktut aglan China mun pinya.
Thank you, Mr. Chairman. I'm going to pass at this time. I think my member from the Satu said it clear enough. Thank you.
Thank you. Member from
Tabarna Yellowknife Center me. Tabarna kuyagi bligu. Oka kuyagi akin naklugu tam na aperwira tuak nakuha kanya kaya. $317 mun tapte mga 2,000 tabar $1 million talatun. $1 million talatun tabar $230,000 talatun ato na nakay. 319 apakiruta kakpat ninyo it. Frame Lake me. Kuya nak. Tabar na mani palihimakaktit. Kuat palihimangit mani Northern Territories ni. Tabar lutay na palihimangukto tamat kuat tay na lutabar ili isuatun it kalwak patap ko palihimalgit. Kuya nak. Kuya nak. Tabar wani Northern Territories ni palihimarot at langarot tawang na tabar tawak na alangarut kanok idihawri ningat mani palihimangok ni aktuat alangarut na wagut angalat takibut alagayatun. Tabar mani Northern Territories ni tabar tawak tay na takpawani palihimangok ni aktuat alangamit. Kanok ilihawri ningat nagalunin tamat kuninga akiliakayat uktoraktot nagaluni ilihakanaktot palihimangok. Tam na taba litsukilang nakakput. Tam na tay na taba tamani piakluwaktot na iba munakaringit. Tabraw na pakirutakaka. Tap tumunga nanalawat si Maichok. Tabralutay na kanok mani na isumati kapko. Kanot na nagalani na palihimanik maunga habak titsinyak pat. Tabraluptawak na kutsikihinyak tokman na piakluwak tuat mani Northern Territories ni tayo naklungay sa malukto nga palihimanikin na ilaw na aktilak rangin
to these issues. Thank you.
Kuya nak. Tabrap kuat inyong kilangit mani palihimat. Tabrap tayo na akili himani akibut tamat ko at piakluk takto at inaralani nagaluni naninakain ni Northern Territories ni. Tabaptaaqtait na tabai iliaugupti taapkua palihimat tabalutait na tunagalan kanok nani peaqluktak paitsuat isumalugiraqigait tabaluptaaqtait na qanutunagalan qoqaartilaangitit na ilihimaniaqaqigaitit nalu tabalutait na tamatkuatit na qoqaartaqpaitsuatit na inaurani na tamatkuatit sumalugiagutiraqigait iñugiakkiliaqaniaqaqigait palihimat maani tabalutait na ikikliiliaqaluartoq tamanna na taitnalu palihimaikupta tamaani tabaptaaqtait na palihimaqartuaqilut tamaani inaurallaat tabatait na kavamattait na isummatiginiaqaat taitnalu taitna tamatkuatit na piaqluartuat ingmiktigun tabaptaaqtait na taamna maani qanoq inaurallaat naagaluunin naniittuat naniliaqaittuat maani nunaptigni tabaptaaqtaamna allagiittut taapkua palihimat matkuatit naqqutsiktuanip tauq palihimaqarmiut tabalutait na tunagalan qanutunagalan na piaqlugartuat isumaalugilaqigait taapkuat palihimat quyanaq taitna tunagalanit na palihimaqaraniartilaaksangit nalupqigilaitkiput taaptumuna quyanaq taamna premium qaullim nakiullangmaa taaptununa inna nakuarineriga taamna nakuarigaluarneriga tamatkuatit na ilitsuariñaaqamat tamatkuninga qanutunagalaan piaqlugartuat tamaani na qailaqartuallu tamaani naluuartillugit huniartilaaksangit tabaptaaqtamatkuatit na isumaalungnartut tabalutait na tunagalanit na ilianhimaniaqaluartilluta ilianiqutsikkiugulut tamatkuatit na piaqlugartuat taba iñugiaktuanik uktuqaqqimatugut ukuat GNWT-ni tabalutait na tamatkuatit na ikayorniaqaqigaittaaq palihimat piaqlugartuat Inuit taitnalu tamatkuat ikayullaruat inaurallaani ikayortillugit taitnalu taortapu taitna tunagalaan tamatkuatit na taitnalu takpavunga aullartitaqarigait taitna maani hapeqleqaming maunga kihianikit na isertauvingnun pilait kaitakpavungartillugit isertauvinginñun aullartitaqigait taitnap taortapu tamaani ilihimaluguttit na qanutunagalaan tamaani ikayortissanik Malruk tapko Ilihauri Rachtuit Malrongnik. Tabre taitna. Tabre taitna tau angotinikit na. Ing ming yun titrikair niartuanun tabre taitna karamiut mani. Angotit kehenik tabre tamna. Na ikayutigid laga ting ming yun titrikair niar kaming. Inyu herting titrikair niar mata. Inyu herman na hu inyu livain milyane. Tamat ko taitna iglo karamiut tamani katimabe karamiut. Angutit kehenik katimabenik. Tabre na taitna tabre tamna iwahalawang naktanga uminga. Kanok ikayutik sanginyik. Tabre taitna ilokain yun okarakama. Okarakap ki ilokainik tamat ko ataulugit na tamna tabre tualuk piyong itchung na rin. Tabre ko at allanik na mat ko at okarakihungit kitka. Tabre wanga kehenik angalalakamnik okarakirunga. Tabre lokata ilihimagik putamna kanutunaglan. Waptingnik ilihimagik putta kanuharautik raptingnik ilihimarugut. Kuyanak. Kuyay tabre tamna. Tamat ko alu tabre ukod itkagilang nere emi ukagilang nere itika. Matkotit na maunga kaibluting nagalunin inaurapting ni inilani tamatkot tautung nakirutuni okairot. Amarihimaslongnik nagaluni sigaklongnik kunigilakaki tamaratuni okaironi kinyugekirutmani nunapting ni tamna apakirutarilaukkiga. Tabre tapkot prim kauklim nagalunin tukliata tamatkot na munarehuvatigit. Tabre atuamilu tamatkot na ikayorobat atuwak mi ituat. Tabre takta wanisatumi. Okailakara tabre tamna pingahoniluni ukiuni tabre tuhanak tok tamna tabre lakataili himagik putamat ko tuni okairoat marihimatlongnik nagaluni sigaklongnik tabre tamanga kaibluting taitna tuni okainagutiraktut tabre taptima nangilaktit kay inuit mani inunertuat. Tabre wapting nigit na kamakidlu kanoherarangidlu wapting nik ilihimagalo akota. Hantatut kaktor tait na tinagalan ikiklip kakayarevut. Aglaan wagutaw wani iwun nioktit. Tabre ilihimarugut. Tabre tawak tait na. Tabre lutam na tait na kanyak tawak tuni isumatigiruni iwun niokotigiruni. Tabre ilokata ilihimarugut putam na wamaruak tait na aktor ilihimablugit. Kuyanak.
Minister.
Tapkot kalihimat First Nation tapkot tangong ichod inuit kanok palihimarot tapkot 7% tun hamma akilichugay tapkot Inuit palihimatayna tangungitsutayna tamani munakrirot 22 tapkot 23 tun hamma 2023 mi 9 tun hamma tapkot palihimarut kuyanak Range Lakeman kuyanak tapkot kanok kanok hanutun tapkot pinyak patapkot palihimat hanutun 13 tun hamma ukot ka 4 ping sisamatun hihamatun tabra palihim ngaruta kanok tangungit nagaluni na inarani pi ikayurot siktun hamma tapkot ichakret palihimat tabra havaktut tamani inarani Fort Providence mitaka tapkot havaktut ikayurot palihimat Range Lakeman kuyanak tapkot habang naktut tapkot tapkot hawklunik tuniyok kairot tabra munak rinyakalwaktut na palihimanik pinyaktutawk palihimarot aglinak kagalaktut kanok tapkot ki hawklunik tuniyok kak paraktut man nunaptingni kuyanak 2019 tamna buvaklaluk inman kanok tapkot havaliginya kot kanoleka tapkot hawklunik tuniyok kairot 21-22 tapkot tiglilinya kot kanok kanutun tapkot Inuit tayna hawklunik atoktot tigligalinnya kot kanutun kanok tapkot palihimat ikayiliginya kay tapkot kanok tapkot kanok nagkokanyak Inuit damani inarani kuyanak tap kanok tapkot kanok tapkot hawklunik atoktot tabra hospital mu annelerut kanok tutqikkaarniarpatigit qanoqqaataapkut taapkut iglunik atuliginniaqut qanoqqaatutiuqqainiarluting hoarlungnik qanoqqa qanoqqa tutqikkaarniarpatigit tutqikkaarniarpalung tainna qanoqqa tainna inuummata huniarpata taapkut tauqa taamani haaruk taapkut sheriff nikatu runeqqat taapkut qanorleqaatavra piniartugut tutqikkaarniaralua qaita aglaan yaani haperniaqqihuyuq taapkut hoarlungnika atoqtuat naagaluuniin tuniuqqairuat tavra avauttariinaqqigaloortut quyana qanorleqaisuaqqinaqqigalortuq qanoqqa tutqikkaarniarpalung taapkut paliihmat havaqparaqaloortut aglaan qanorleqaatavra ikajornaqqirit taapkut qanoqtaapkut paliihmut quyanaqtaapkut qanoqqa tutqikkaarniarlugit havangniaraloortut qanorleqaatavra taapkut havangnaartoq ikajornaqqirit taapkut paliihimat taapkunuuna qanoqqa hoarlungnik tuniiqqairuat naagaluuniin atoqtuat qanoq paliihimat taapkut ikajornaqqirut taapkut piniaqqit taapkut qanorleqa nyuittavra tautsikun havangnaqqirut qanorleqa piniarlugit taapkut hoarlungnik innuiartuat innuuruat qanorleqaatavra ikajornaqqigaloortut qanorleqaiñuit ikajornaqqigaloortut aglaan yaani haperniaqqihuyuq Range Lakeman quyana qanoqqa kanok pinyak patap kot habang nakparong tam na kanok tap kot tunio kairo tay na hoaklung ni kanok nut kaktin niyak lugi tay na habag kalak tut kuyanak kanok tap kot pislukak tot kanok tap kot tautung nakirit kuyanak Yellowknife North. Tap kot kanok tap kot pislukak tot kanok tut kikkaranaraloq tut aglaan kanorulekatavra havang nakkigaloqtoq kanok tut kikkaranarlugit kanok inuingit Inuving mihamma Beaufort Delta mi tap kot hoaklungnik tuniu kairo tavra tap kot kaunagi nakkigaloqtut aglaan tap kot habaqtuuttainna nutqaqtit naqqigaloaqait palihimattau qabaqpauraqaloqtut aglaan laanni hapaqnaqqihuuruq kanok habauttaqiniaq marru kanorulekatavra habauttaqinaq qigaloqtoq nutqaqtit niaqlugi tap kot hoaklungnik tuniaqairut qiyanaq tap kot kanok palihimat agliyaqaniaq qanutun havaqtuut agliñaaqaniaq padigit qanutun kanok allanik tutqikkaqaniaq patigit qiyanaq kanok tap kot tauqa tap kot lawyer niktai hugay tap kot ikayoqtit inyungnun uqaqqitaqtuat kanok tap kot hoaqlunik tuliqairat ikayoqtaqqaqtut tap kot kanok qaqqitaqtut huniaqpat aglillaaqpat huvat tap kot tabra uqaqqitaarmata tabra tap kot akil akiliqanaqqihuurit kanok habauttaqiggaluaqait kanok tap kot tabra havang naqqiggaluaqtut tap kot cabinet niktai hugait minita tap kot havang naqqiggaluaqtut
and those need to be
Tabraptok tamna Inuit ilokainik ataulugit ilitsuqip kaanaqqigaluartut. Okay, you'll have sentiment. Kuyanaq. Tabramna huamahidlaukkiga qauhiq. Tabralutaina tunagalan. $321 nulakta. 2024 May. Tabrana taina tunagalan. $67,000 tunatoqnailgiñaqut. Kuyanaq. Tapkaptaq qanoqhabautaqañaaqpatigit kavammanun. 324. Apaqruutaqaqpata. Kaislemin. Kuyanaqaqaqti. Tabrauna. Una apaqruutaqautiga allanganeartoqumanga. Tapkotabra na ingmingnik litsuqip kainiartuat qanuharautimingnik.
To ensure the alignment with federal initiatives, et cetera, et cetera. I guess my question would be around the legislation division. So, let alone the number of LPs in just simply the Department of Justice, the function of the legislation division acts as a drafter for the entire government. So, what metrics does Justice have in place for quality but expedient work on?
Tapkot Khandarlan Legislative Assembly allangoonaqpat patrung naagaluunin ilitsuqip kainiarpat taaptaminga. Tapkot na nalarutimik piitsung nartagut. Tabralutait na tamatkot metric nik pirarigay tabrataaptaminga piitsugut hulipang mapak. Tabraptautamna na ilitsuqip kai piarlunga ilitsuqip kai ngitsung naanakonga. Tabrapkot havat natunagalan piqartilaaqpat qanoq tabratait na tamatkoti na kutsikkiiñartut pihuktat tabra tauhimiumaniukiumi. Kuyanaq pakkau no. No thanks. I got some.
Bottleneck is with the French translation.
Tabrokot French tun iloqainñaki na mumiktinniarivut. Taitnaluutauq tabra ikayuartaqartugut looyanik pilarigaitin na itluatun tutqikkaiñiartuat tutqikkaiseqartugut. Taitna looyaqqangihaaruta pilaitsugutuaptikkun. Taitna tabra iloqata taitna agalaktanik na pihuktanik agalarugut tamatkot munaqriruat illuatun angalatsit quriruat tamani kaktin nagit tabatay na pilay chugud. Kuyanak. Great Lemin. Kuyanak ko kakte. Tabraw na ilitsakira kramik agalaga urugutin na agalakusang nik ilyakira kayo tamat ko apekruta mo tila ni tao tumitsutay na nik tabraw na ilitsakira ko lirit kaw ko tabraw ko French tun na mumigtichiro nagpakakpehe. Kuyanak. Dahil na ito nagalata ba nalok kayak to. Nalok pahuk to ngayon na kuyanak. Dahil na French tun mumigtichirimik bichung naktagut tabat apakroy takangit pata. $14,036,000 dun. Kinaranig pakaktud. Tabay lokay niktay na ataw luwit mani nunapting ni tuhara krang ito na. Tabay pakakta kakpata. Pinyak. Great Slaveman. Kaya na kakte. Tamat ko atin na kihut akilira kabat inawramik tahit na ang mingtigun na kutsik to ani na atanaw raw kami kuyanak tabrelo katatay na ilihimagay putam na kuyanak. Kuyanak. Tabar tam na pekruta kay marung tabar tam na tao uti ilitsa kay fao Section 30 me. Kaya na tabar tamat ko dit na tap ko pilyak patigit na galunin. Tutkikalak patigit na ko kayo na yakiga. Ilo akin na yakigali. Kaya na. Nalop kayo ito nga mga kanok kafe niyo ni tabar Emily ko kamahuli. Tabar tamat ko dit na ilyakira kaming tamat ko dit na kanok kanito ni na kinyaranik atuwak tila krangit na inaramingnik. Kuyanak. Great Slaving. Unang misihita mo na pakiutakal lang na likiya. Hawk 23-24 25. Tawa ko ka ikilkaanik pa tap kong ng 22-23 min. Tam na Mr. Bangkok kiup ka lang nerya. Tawa ko tawa ni naitut. Tawa letay na tamat ko di na inawranik na inawranik na iliyakan yaktot kanutun akihutilangin nik tam na tawa apakhutarilla kanga kiulakkiutay na. Tay na lumtak tawa tay na isuatun na piyak tay sakunin tamat ko di na inawratin akiliyakrangin nikin na hingit kalwariga agalan tay na tawa tamat ko kani sumalubluit inuit tamat ko nga inawranik na atornektot isumalubluit piga. 2024, 2025. So $5,027,000 to na tornel kitchit. Kaya na 329. Apakir takak pata apakir nakriga. Kaya na 297 me. 298 tam na apakir takak pitap timuna pin pat 2024-25 me liu tam 158,568,000,000 jun tam na atuti siya nga ti tuwarin Inuvialuktun lake. Kaya na tawa na una nudi chuk kogiya. Kaya na nukti takramot ilokating nakuha pa rin nakakakta magpakakpa. Tawa tam na pianigir. Tawa tam na pianigir. Kaya nakpat tawa kay kape. Tawa ko kan nichuti lakik. Kaya nak kay malang naktiwit. Kaya nakpak.
Order. You take all your seats, please. Order. Thank you. We're going to continue on. Thank you. We had a nice little break, and we'll take another break about 8:30 to give translators a chance to have some tea, coffee. Okay. Anyway, I'm going to continue on. Consideration of Committee of the Whole of Bills and Other Matters. Main estimates 2024-2025. Department of Health and Social Services. Committee will now move on to the next department. Committee, we have agreed to consider table documents 93-20 brackets 1. Main estimates 2024-2025. We will now consider the Department of Health and Social Services. Minister of Health and Social Services, please proceed with your opening remarks.
Thank you, Mr. Chair. Mr. Chair, I am
2024-25 damna kanutun atonak maningnik 36.5 million. Tapos 23-24 tun. Tapos kanutun maningnik atonak tot $28.3 million. Tapos sa kanya kangit Inuit at tamading anakming mi. Tapos $34.1 million ato ko naligin yakot. Ato niligin yakot. Got 20th Assembly 2024 tap to me. Tap got kanadun nako kanyak lugi public health. Tap got kanole katabra iswa kanyak lugi Inuit tabra. Kanole ka iswa ikayonak lugi Inuit tabra nako kanyak tot. Koyanak. Health and Social Services ikayaktik kanaktok. Tamna ikayaktini lang niya ait. Deputy Minister Joanne Kittle, Jeannie Matheson, Tapkat apikri nyakpat, Frame Lakeman. Koyanak. Okata okalang narit ka. Okata Avautarinea kangit business plans niktai hugait kanok havangnek patukot tapgot primary care system tapgot kanok nutak kanek ko nakalunin kanok leka ay anyak tat munaganiak lugit tapgot kilamikat ilitsoriniak lugit tap ilitsorinat kanok annelar matainuit primary care miktai hugait kanok tapgot tapgot okautikam okautikap kitabra agency nurses nik now tapgot nursirit munakrit kanok yung nik annermata tapgot ikayuinyarorit nursirit munakrit got okarinang minkitka tapgot kanok tapgot kanok kayanak 195 apekruiniak patinuit kan minidat emalet great slave min kayanak 198
The minister speak to, I'm noticing here on the line
kanok tapgot tapgot habang nata operations niktai hugait kanok kanok tapgot habang mata inawarini kanok hibumi havaktot 22-23 tapgot habang matatay na kanok agilyanak pata nagalunin inyak patay na kayanak idiom 23, 24, tap good. Tap good habang matatabra. Habang matatap good tabra. Kanok habaw taringit tabra atokonat makpiat tap good nagalunin kinyarinit. Tap good atokonat kayanak. Apekhrui farnerpad kihuleka. Oh, 2024-25, $58 million to $109,000. Inuvik Lake. Koyanak. Koyanak. Yeah.
No further questions? Oh, sorry. I'm going to go to the member from Yellowknife North.
Thank you, Mr. Chair. First, just
Tap good tap good kanok habaw tine habang nakto tap good transitional niktay huga tam na nuktek mata. Kanok habang nakpad HSS. Kuyanak. Ukwata. Ukwata kanok $1.47 million. Tap good habak pang igilulaki riptaw ka tap good kanok tap good tap chicken habang takinarat kuyanak. YK North. Kuyanak. HSS tap good habang naktonik inying igunek rebat HSS kanok habang naktut kanok lekataw chicken tap good kanok taw chicken habang ina higput tam na kanok habang naktut tayo na. Yellowknife North. Kuyanak. Tap got kanok HSS me kanok havang nekpat. Kanok havang nekpat tap got ikayoktit. Munakert. Minitakam na kilabi nga. Tap got kanok lekatar havang nektat. Tap got kanok tap got igluning niya tap got havak totay na. Kanok tam na indigenous government tap got tangung short government tam na pinyagat. Tap got aftercare kanok munaranek tot munaranek tagitinuitay coming I coming trucking tot iling engming you taber munaranek tap got kanok tay na ikayorlugit ikayornek lugit tap got igluning nak lugit tap kai I wrote taina got health and social service kanok maning nikatokpat. Kuyanok. Ibakler alok kiu fremnik. Yellowknife North. Tap got agaling nik piu kalok pinyak. Pinyaw finga tabertaiku. Kanok pagitnik tay hugay maning nik pinyak tot atonek tot nagalunin about taganya kangit. Tap got kanok tap got ECNE tap got havang nekot tau chikun ECNE kanok tau tap got tau health social services tap got tau chikun havang nekot. Tap got nun nekot havat to ECEC mun. Pihukalorning kong aglak tingnik tainak kanok. Community clinics and health center tap na tap got munakrirot inyong nik kanok anak tonik kanok. Tap got 82.5 million din atulin yakut 22, 23 taptuma. Kanoka miklivet hok apai tabra miklinya kot kuyanak. Tap got federal government in manikret manita. Tap got sunsetting funding tap got tai na kanok 2.5 million to Yellowknife North. Kuyanak. Tabra tamakpatap got havat inaret nagalunin havak totay na tamak pingit pat pinyangit pat huvat kuyanak. Ukot COVID COVID puvlalok inman tabra tam na atok parak tot maning niktap kot tam na pichok. Kuyanak. Kuyanak. Kanok pinyak but kanok kanok havang yak parang tan na kanok kuyanak. March 31st time aktot. Tap got karanangit kit ka tabra o karibut huli. O karibut huli.
Thank you. I want to go to the Deputy Minister.
Thank you, Mr. Speaker, and thank you, Minister. So it's very odd hearing yourself speak. Sorry, apologies. What we can say about the COVID, the reduction of the COVID funding was primarily to support activities directly related to COVID. So things such as testing centers, things such as vaccine efforts.
Hang on a second. We'll just wait a couple of minutes and we'll try to get it sorted out. Testing, 1, 2, 3. Lizzie? Testing, 1, 2, 3, 1, 2, 3. 1, 2, 3. Testing. Under the B10. Testing. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Tutti. Testing 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay. Testing. We'll take a 5-minute break until we get this sorted out. Testing 1, 2, 3. Mizzy? Mizzy? Yep. Okay. Testing 1, 2, 3. Can all thumbs up? Mizzy? Okay. Con le son. Okay, then we'll continue on. We got the that issue resolved. We'll continue on with a member from Yellowknife North.
Thank you, Mr. Chair. I think we were just in the middle of an explanation as to possible impacts to public services of the reductions to the line of community clinics and health centers for primary care.
I'm going to go to the minister.
Okay. Thank you, Mr. Chair. So going back to the COVID endemic funding, so when that sunsetted, we also, and I announced, remember I did that long list of all of the different funding pots that we just recently, so the shared health priorities that we got funding from Health Canada for activities under the new bilateral agreement, and the working together to improve healthcare for Canadians, which includes family health services, health workforce, and mental wellness, substance abuse. That was an increase of $4.382 million to this budget. There was an increase with the collective agreement, so that offsetted so those positions that we had, that long list of positions that ended with the sunset funding of COVID. We tried to mitigate that with a lot of the new positions and it also covered some of the positions that were, where we were keeping with that funding. So it's kind of more of a math thing in here. We've sunsetted this much, and then there was an increase of the 4.382 million to offset some of those costs in that area. Thank you, Mr. Chair.
Okay, thank you. The time is ended on the 10-minute mark. I could put your name back down if you wanted to go further. I'm going to go to the member from the Satu.
Thank you, Mr. Chair. I'm glad to see that there's an increase of 6%. Hopefully it's going into the right programs and being as efficient as it could be. And when we hear a lot of the news on lack of nurses, so we got to rely on agency nurses, and we hear the ongoing delivery problems with medical travel, pre-assessments. So when I hear that and I look at the business plan and the supported financial documents to that plan, and I look at the list of programs or health and social programs that this department's offering and services and so on. So taking a real holistic approach to this, knowing there is some weaknesses out there. Is the department going to entertain or going to pursue a outside management evaluation of this department? Is it part of that goal to seek an outside opinion on where can we improve, what policies need to be changed, what funding has to be moved to be more efficient because of the demand? So I just ask that question, if there's going to be an outside evaluation to help improve our system of delivery, including staff retention. Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Mr. Chair, there has been a number of reviews within this department. One of the most recent, we have the governance review, and I know I've mentioned it in this House, and we're reviewing that. It was an outside independent review of the governing structure of the NTHSSA, and within programs and policies, I think that's one of the things where when I look at with programs and policies, this is where the direction of the mandate, the direction of the business plans, this is our job as the legislative assembly, and the direction of our priorities to put that focus on where we want to see this department going. And I think when we look at our business plans, as one of the areas that, when we talk about putting those high level in the business plans to our departments to give that direction, that is where that, that leads what policy work and things that are going to be reviewed and followed up and held by this House to make sure that that's what's happening. Thank you, Mr. Chair.
Thank you. I'm going to go to the member of Son 2.
Thank you, Mr. Chair. Yeah, it was more of a suggestion on how to improve our management system. The management system is really the governing organization of this department, and if we have collectively identified various weaknesses, how do we fix that? So it was a suggestion. We do have a co-management structure in place called our territorial wellness and regional wellness councils. So I've been telling some leaders back at the SATU, we have this joint venture, or whatever you want to call it, in this case co-management system, to deliver and improve our services, because our people are coming to us for assistance to mitigate through that. So that vehicle or that wellness council could be used in our headquarters to see how we can improve out there. Thank you, Mr. Chair.
Okay, does the minister want to respond to that?
Yeah, no, I appreciate the members, you know, putting the word out there on the regional wellness councils, because one of the things that I do as the minister is I work closely with the Leadership Council, and they are the governing body of the Northwest Territories Health and Social Services Authority, and they are, you know, they get the direction on, you know, what our priorities are as well, and they are the ones that are the administrators of all of the health programs. So it's really important that the Northwest Territories realize that those regional wellness councils are the voice of the regions, and those issues that they bring forward to the territorial leadership is what guides the governing council, which is made up of all the chairs, to direct the Northwest Territories Health and Social Services Authority, as well as direction from, you know, myself with, you know, with the chair, and coming from this house, you know, like the priorities of this government, you know, that's what directs. And so that, like, I appreciate that this is a collaboration between, and that model was very supported by Indigenous governments, as it is the voice of the regions. And so it's very important that regions know that when people are being appointed to how important their role is in the voice of the regions of the Northwest Territories. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Satu.
Thank you, Mr. Chair. That's all I had at this point in time there. Masi.
Thank you. Is there any further questions? I'm going to go to the member from Maudfui.
This one, yep. Okay. I see in here community clinics and health center, there's a decrease. So what services, what programs and services are affected by this decrease?
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Mr. Chair, this is where the sunsetting is, so the labor market supplements and the COVID endemic funding. That is what is the decrease within this department. Thank you.
Thank you. I'm going to go to the member from Maudfui.
Okay, thank you. And the community mental wellness and addiction recovery, I think this is where that the transitional programs or for housing for addiction recovery, I think you said it's under this community wellness. I just wanted to ask, I know that we've been talking for the last 2 days the impacts of drugs that it has on our communities, on our people. And in Betchiko alone, you know, like, I mean, we have a huge problems. And when our residents, they go for treatment, some of them, they go back to the same old. Everything is still the same. There's no change to the place that they're returning to. And there's nothing, there's no aftercare. So some of these people that we're talking about, they last a day after spending like 2 months. And I know that it's greatly needed. I'm glad that you guys identified that, but it's going to Inuvik and Yellowknife. But some of the people don't want to leave our community. So I know there's a great need for one in Klutcho regions because we still have issues with because of there's no aftercare. Some of these residents are going back to a place where, you know, all the activities is still happening and they're still homeless, you know. We really do need a program similar to the one that's going to be allocated in or going into Inuvik and Yellowknife. We need that service in Klutcho region, probably in other regions as well, because for the last 2 days we've been talking about the impacts of drugs and alcohol, especially drugs, you know, and that it has on our people. So I just want to ask the minister if, I know it's not in here in this budget, but if they can, I'm just wondering, is that a pilot project?
Thank you. I'm going to go to the minister.
You know, to see how it goes.
Thank you, Mr. Chair. Mr. Chair, I guess where to start is that the department, you know, working with, as I mentioned, with housing and infrastructure, and did a kind of a call out to and got some interest from different NGOs, and so we were able to come to an agreement with two within the funding agreements, like within the funding and the resources that we do currently have to be able to move forward on two. You know, however, I hear the member. I know this is you know, we don't know how it's going to work, but we know it's better than what we have. You know, there's nothing, right, for aftercare. So I think this is a great initiative, and I look forward to this initiative being able to support people in those two communities. And, you know, I will, any Indigenous government, any NGO that, you know, I think would benefit from these in most of our communities, but as right now our resources are tied into these two programs. That's what we have enough for. If there are Indigenous governments that want to work together and, you know, and they have ideas of things like this is where I think we want to do things differently. We want to work with Indigenous governments. You know, if they can access funds, like there's new, within the 2024-2025 federal budget, there are different pots of funding that are specific for Indigenous governments under mental wellness, and I think that we will find out what those details are. We have stressed from the Northwest Territories to the Federal Minister of Health on what the needs are of the North, and so we're hoping that will help form their decisions and policy to be able to support us in the Northwest Territories for more programs like this. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Monfouille.
Thank you. Thank you for that, and I think I'm sure our leaders are listening. So I guess, you know, and I am glad that, you know, that you said that this government is working really hard to maintain a good working relationship with the Indigenous, so which is good. So I know that something this kind of program, it's good for other regions as well. So hopefully we will keep it in mind for the next fiscal year, you know, because due to the resources we have. So this program for the transition program that's going to Yellowknife and going to Inuvik, is that going to be operated, the service provided by the Health and Social Services or NGO? Thank you.
Thank you. I want to go to the minister.
Thank you, Mr. Chair. Mr. Chair, the day-to-day operations are going to be, of running the facility is going to be by the NGO. However, Health and Social Services' role is to support that NGO and the needs of those clients in whatever area that they need to be successful in their recovery. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Monfouille.
Okay, thank you. And also, I see here, okay, the compensation and benefits this fiscal year for 23-24 for the main estimate went down for 24-25. Do you know which region is impacted by this?
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. I think the reductions in this area was part of the sunsetting of the Northern Wellness Agreement related to, and then there was a reduction in COVID endemic I don't have the details as to specific which region those were, but we can figure that out and get back to the member.
Thank you. I'm going to go to the member from Montfouille.
Thank you. Yeah, that's.
I'm going to go to the member from Great Slave.
Thank you, Mr. Chair. So I want to preface this question with the fact that I've had really good conversations with the minister on this, and I think where she and I differ on the perspective of this issue is the how, not the why. The why being, of course, that we want to have midwifery services in our smaller communities, especially for our Indigenous folks who are giving birth. So my question, however, is, given that the GNWT has made repeated public commitments to the expansion of midwifery in the NWT, how did it arrive at the decision to discontinue the establishment of midwifery services in Yellowknife and the surrounding communities without consulting the public, the Midwives Association, the NWT Advisory Committee for Midwifery, or the Indigenous Advisory Board? Thank you, Mr. Chair.
Thank you. I'm going to go to the member, the minister.
Thank you, Mr. Chair. Mr. Chair, this was part of the Restoring Balance, and so those conversations happened, and so we had to make some tough choices, as many ministers will speak to some of the tough choices that we had to make as a government. So thank you, Mr. Chair.
Thank you. I'm going to go to the member from Great Slave.
Thank you, Mr. Chair. Could the minister elaborate a little bit further on why midwifery in Fort Smith and Hay River is considered adequate in her mind to base expansion to midwifery in the territory? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. Mr. Chair, midwifery began in Fort Smith, and midwifery in Fort Smith began with 2 midwives. And those 2 midwives did majority of the births, and if not all the births, in Fort Smith, and ran the only midwifery in the Northwest Territories. I don't have exact dates, but we have expanded that program over the years. So midwifery expansion happened in Fort Smith to an additional nurse. Then it expanded into Hay River, and currently they have expanded from Hay River into supporting Fort Resolution, Denenakwe, and the Métis of that community. As of right now, we've had to suspend that service because of staffing in those in Hay River. There is a current vacancy there. We have just recently gotten Fort Smith since February back online to be able to providing births. Those 2 communities are very fragile, and we need to make sure that those expansions there are successful in the Northwest Territories before we can expand further. And so the choice was to put the efforts into supporting those two communities, ensuring that those communities that do not have any other choice, don't have any other options of birthing services, to ensure that those programs are stable. Thank you, Mr. Chair.
Thank you. I'm going to the member from Great Slave.
Thank you, Mr. Chair, and thank you to the Minister for that explanation. I deeply respect midwifery in both Hay River and Fort Smith as necessary and crucial to those communities. However, the arguments that have been presented to me from midwives here locally is that Yellowknife has a high number of births and the opportunity to be a place where midwives, Indigenous midwives, can learn and seek to become a midwife here in the territory. It's very difficult to get into midwifery school outside of the territory, and to build that capacity up and to cut off the program here at the knees is a little bit frustrating. And I mean, I know the minister knows it's frustrating for these folks. They're being very very vocal, as is their desire. But I guess, is there any desire to continue the Yellowknife program in some form? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. I want committee to know, and I want the members to know, and as well as the public to know, that there was actually no program, because there was no positions. They're all vacant. They have been vacant. This, the vision of, yes, making Yellowknife a training ground but that, those are just visions, and and I hear the member, and I if that was something that that was happening, that would be very hard. But with the positions, this has gone back many years. It's gone back to that. There's been sporadic. We'll get a midwife, and then it's not successful. We don't have enough. The positions, they're not being filled, and so here we are now, and having to make decisions within this government, knowing that there's areas where we could utilize different areas of funding. We've heard from the members loud and clear all of the needs that they want, and all the new things that they want, and all the new things that I want to do as a minister to make changes. And so this money has to come from somewhere, and these positions that were vacant for many years, this is just one of the areas that we had to seriously take a look at. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Greensleeve.
Yeah, thank you, Mr. Chair, and thank you to the minister for that. I guess I'd just return the volley and say, there are 2 student midwives who are here as summer students in the health work in town right now at this moment, and I guess I'd put back to the minister, where are you going to recruit from? Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Mr. Chair, we have vacancies in Hay River and Fort Smith. When we look at midwifery, and if we're looking at expanding those students, I mean, there's jobs throughout the territory that are not always in Yellowknife, and they're not always in Inuvik, and they're not always in Hay River. And if those are the areas that we want to train in, sometimes we have to go and move to where those are. And midwifery, when I look at midwifery, I do support midwifery, because I do support it to be there in those communities that don't have any birthing services. So, like I said, there's vacancy in Fort Smith, and there's a vacancy in Hay River, and so there's and there's always support there. There's ways that we can support those nursing students in those communities. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Greensleeve.
Thank you, Mr. Chair. I think we're both entrenched in our positions. I'll leave it at that.
Thank you. I want to go to the member from Mackenzie Delta.
Thank you, Mr. Chair. It's good to see the community mental health, wellness, and addictions recovery with the an increase than this year's mains. I've always stated that community-based programs will work for our people who are hurting. This is no different. So my concern is funds going to the regional government versus the community. I can see funds going to the regional organization in terms of providing addictions counseling, and for example in the Beaufort Mackenzie Delta region, the Gwitchin Wellness Camp, I'm sure it's going to be funded because there's a lot of interest. There's a lot of individuals expressing interest, and people who did go for counseling, but they had no aftercare. So it'll be good if some of these communities can access funds to set up a friendship center, because I've noticed when people do come back from addictions recovery programs, they have no place to go. They wander around the communities, and within a week, they're back with their old friends because they have no place to go. In the past, they had friendship centers where you can go and hang out or actually get counseling from qualified people who went through these traumas. So will there be more funding for communities to access funds to start up sort of a friendship center or a service center where clients can go and meet with counselors? Thank you, Mr. Chair.
Thank you. I want to go to the minister.
Thank you, Mr. Chair. Mr. Chair, and I really appreciate the member for bringing one of the things that I think when I looked at this fund last week before I went out to meet with an Indigenous organization and community was that the Community Wellness and Addiction Recovery Fund was opened to regional governments until January 31st of this year to apply for multi-year funding. Only 3 organizations had reached out, and so now that those 3 organizations has reached out, there is a little over $3 million in that fund, and it can be used for mental health and addictions in very flexible, as I mentioned in the House too, as well, that it could be used for on the land, it could be used for any Indigenous government so in your communities can apply, each one of your communities can apply on this fund. It's a first come, first served basis. I can provide more details, and I think I am actually got my department, because when I recognized that it wasn't being accessed as, so I encourage them to put together something that I can send out to all the MLAs so that they can let their Indigenous community governments, because I think with this fund it's for Indigenous governments, and then there's also, not just under this fund but the Suicide Prevention Fund, there's another additional pot of money that can be accessed and is flexible to use towards suicide prevention in your communities. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Mackenzie Delta.
Thank you, Mr. Chair. Thank you for to the minister for providing that information. We have it's good to see that there is projects such as on the land-based programs. It'll be good to utilize some of these funds for that. So I will be informing members of my region that there is a limited amount of money on a first-come, first-served basis to help their community residents. On another note, long-term care and continuing care services. In the past, in the Klavik, they had the Joe Greenland Center, which was used very well by the whole region. There was people from Old Crow, people from Fort McPherson, Sigachik, Inuvik that stayed in this facility because they were looked after well, and they were looked after by indigenous workers, so they felt comfortable. And right now that facility closed, and it's used in a different different way. And what I've been hearing from members of the community of Aklavik is they require more community support services, because elders who live at home, they don't, they have to administer medication, and sometimes they have multiple meds that they can't read, or they don't know which ones they're supposed to take. So I wonder if there will be some increase in the community support services specifically for Aklavik, where They've written a letter stating that they do need help in this area. Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Mr. Chair, that is in a different section that we haven't got to yet, but under this section, I know there is home care and home support work that does support communities, and so if you want to move on to the next section, or did you want me to wait and to answer to that, and when we get to that section, Mr. Chair?
Thank you. I think we could wait till we get to that section. I'm going to go to the member from Mackenzie Delta.
Oh, I'm good there. That's good. Thank you.
Thank you. Okay. Now, next on the list I have is the member from Rangeley.
Thank you, Mr. Chair. Mr. Chair, so I know that there's sunsets to, and I'm not sure if they're here. So anyway, so just related to labor market supplements, to recruitment, to referrals, to recruitment and retention period, and it's close to $3 million. So how is the department making up for this? I know we're in the midst of a bargaining process. So is there a plan to bring something, is there a reserve being set aside in case there's a need for this resource to be brought back once those negotiations are concluded? Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. It'll be, details will come after bargaining is done, and I think there's not much more information that I can provide, as I don't have that. Thank you.
Okay, thank you. I'm going to go to the member from Range Lake.
So the labor market supplement was brought in around, like many provinces and territories are bringing in those kind of bonuses during COVID when healthcare professionals were leaving the profession or going towards private agency jobs that are much more lucrative, and the supplement existed outside of the collective bargaining process through an agreement with the union. So can the minister explain why we're waiting for collective bargaining to decide whether or not to bring that back? Because my understanding is it's not related to that. It's in addition to the collective agreement. Thank you.
Thank you. I will go to the minister.
Thank you, Mr. Chair. That agreement expired on March 31st, and that agreement was decided during an urgent need during COVID, and so it's now part of, now there's collective bargaining going on, and so there's, like I said, that's probably as much as I can say about that. Thank you, Mr. Chair.
Okay, thank you. We'll go back to the member from Range Lake.
Thank you, Mr. Chair. Well, I look forward to the conclusion of collective bargaining. Then, hopefully, we have clarity on what we can provide to frontline healthcare professionals. So I'll turn to the midwifery cuts and also to the need for agency nurses to staff obstetrics at Stanton Hospital. Why is the department having such a hard time providing birthing services in the Northwest Territories or investing in birthing services? Because it seems like we're not really interested. Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. For myself, I was a labor and delivery nurse, so I don't understand why nobody wants to be a labor and delivery nurse. So, but for the most part, I know even when I was a manager trying to convince some nurses to go and train to be a labor and delivery nurse, it's a specialty. It's just like any other thing people want to do. And what I think for a long time here, one of the issues that we know that within the current obstetrics where everybody, I mean, it's not a secret that there was many vacancies over COVID, and then that's when, it enacted the time that we needed to start using agency nurses to ensure that we could provide birthing services back in Yellowknife. And since then, we've done lots of training. We've trained nurses. We've provided training. We provided combination training of education so that they could get the mentoring and the specialized training to be able to become obstetric nurses. And so we're starting to get more in that area. As of right now, they still need mentors because they're not independent, and so that's why we're still having to use agency nurses to bring in, because we don't have any permanent staff that are available or able to recruit at this time. And our goal is to be able to train enough the nurses, and then with the change in model and supporting those registered nurses to be able to work at their scope, we've changed the model so that we could bring LPNs on into the obstetric unit, which wasn't there before, and that is taken off the weight of the RN so that they can do the job that they need to do, and then the LPNs can support them in that department. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Range Lake.
Okay, thank you, Mr. Chair. I was going to ask the minister if she cares about obstetrics, and clearly she does, so I appreciate that. So when's this going to kick in, right? Like, because this sounds like a plan. It sounds like we have the resources coming together. So when can we expect this new model to take over and the agency nurses to be relieved of their contracts? Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. It's currently ongoing right now, so that's the process, and that's what we're hoping, that we will be able to phase out the use of agency nurses, in that area. And so it's currently, we had a forced growth submission, and that's in this budget. So we're hoping that, that will support that those additional nurses in that unit. But we are actively doing that training, and I think recruiting, and I think there are LPNs now being trained into that unit. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Range Lake.
Can the minister be more specific in terms of a target? Like, ongoing doesn't give me much comfort. Ongoing could be 30 years from now. So I'm wondering if we can get a fiscal year that meets the department's timelines, because of course they can't offer this training indefinitely. There are budgets attached to it. There's staffing attached to it. So can the minister give us a fiscal year when the changeover will take place? Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Mr. Chair, this is, like I said, I'm sorry I can't give you a specific date or time. There are the nurses that are going through this and being supported are at different levels of where they are, and it can take up to 1 to 2 years for that specialized to be independent in this area. We want to make sure that they have all the training that they need to be independent. Thank you, Mr. Chair.
Thank you. We'll go back to the member from Range Lake.
Thank you, Mr. Chair. So 1 to 2 years, that's what, 2026? So could the minister commit to phasing out agency nurses by 2026? Thank you.
Thank you. I'm going to go to the minister.
Thank you. Thank you, Mr. Chair. Mr. Chair, I can't commit to phasing them out, and the reason why is somebody might go on mat leave. Somebody might move away. I can't tell the future of what the future of the staffing model will be. We phased out by utilizing a lot of our education programs, the agency nurses in the operating room, but every time somebody leaves and we don't keep them, that there's an opportunity that service could shut down. And as I mentioned in the House this week, is that some of the smaller communities, it's not just it's not just Stanton, it's not just Inuvik, it's keeping the health centers open when we've exceeded every other way to try and recruit a nurse to ensure that that health center doesn't close, and that will impact our small communities significantly if we didn't have an option for them. Thank you, Mr. Chair.
Thank you. I'm going to the member from Range Lake.
Thank you, Mr. Chair. If you look at trends in public healthcare systems that use agency nurses or private healthcare agencies, it always starts small. It's always a department here, a hospital there, a clinic there, and they start, and it keeps ballooning and ballooning and ballooning, and soon it's $65 million to provide a service that used to cost 10. And this is the case in Ontario, in Quebec, in large centers. It's the case in smaller provinces as well. I am watching the time, so I will wrap up here so the minister can respond. But if you put an agency nurse into a small community, you will never get any other type of nurse in there because you'll never be able to meet those wages. And then we're paying a huge premium for every community health center. Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Mr. Chair, I think many of our communities are, we have different models that are going on in our communities. We have job shares, we have term nurses, we have full-time indeterminate ones that have been there for years. The last resort that we want to use is agency nurses, and as a nurse, I know that sometimes, yes, you're frustrated with that model, but when you're the only one in there and that's the nurse that's going to come in and relieve you so you're not working 24 hours a day, you're very appreciative to have some time. So I hear the member, I hear the concerns. What I can do, and I will continue to do for the Northwest Territories, is continue to advocate at the national level that this is a national crisis. Like, this is something that our healthcare system cannot sustain in the Northwest Territories, and it cannot, our public health system in Canada cannot sustain this, and so I will continue to bring this to the national table at the FPT tables. I am a small territory, but I'm pretty loud and I can be pretty strong, and I'll play the room if I have to do. I mean, this takes the country to change. It's not going to be me saying I'm not going to use these 5 nurses this week. Because they'll just go somewhere else. And as long as they have somewhere else to go, we will continue to lose nurses here. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Inuvik Boot Lake.
That's me. Thank you, Mr. Chair. Mr. Chair, first of all, thank the minister, staff. Monumental task, huge department. Appreciate the work you guys are doing. I've been an advocate obviously for addictions, mainly for aftercare, and I'll certainly be speaking with the minister on that come capital budget time, and be prepared for that. But I know for now, as I spoke to my member statement today, the Gwich'in built a wellness center, have a wellness center that they're working on using for trauma and for different addictions. We know that the Inuvialuktun Regional Corporation are in the process of building a family center, which again will be focused on wellness. So I guess my question is, from the business plan, what has the department been doing or planned to do, looking with regards to kind of interaction, cooperation, if any, with these two groups, and any possible maybe redundancies there as well that we can probably see as they kind of continue, as the Indigenous governments are doing in my region, ramping up in all areas, and this is certainly one of them. Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Mr. Chair, this is I hear the member, and we've started our bilateral agreements as a cabinet meeting we'll be meeting with all of the different Indigenous groups, and this is one of the topics that I'm sure will be on the agenda when meeting with the Indigenous groups in the region, and how do we work together. I know that that they have very good leverage on federal funds up to date to be able to do the things that they've done with their center, how they run programming and how we move forward. I think we will continue to work close with all Indigenous partners that are running programs, as I said many times, and you'll see in the business plan that we we want to be able to have as many wellness and culturally relevant programs to people in the regions. And so this is where I want to make sure my focus is that how do we work together in collaboration? How do we work together to access as much funds federally together for the operations of not just that program, but Inuvialuktun has their program going. I know that the Tlicho has programs that they want to do. Every single government I've heard from, I've spoken to, we all heard from all of the Indigenous governments when we were elected that they need money and they want to work together on programs for their people in their communities, and that's what I want to do with them. Thank you.
Thank you. And we'll go to the member from Inuvialuktun.
And thank the minister for that answer. And yes, of course, I mean the funding that they received for the Gwich'in Centre to renovate, they got from the feds, and I know that the Inuvialuktun as well got federal funding to build their new centre. And yeah, we need their money likely more than what they need ours, but certainly for programming, and I get that, and I know both these programs will dovetail very nicely into the new aftercare center we're going to build there next year. So that's great to hear. So the other thing I wanted to just mention, and I know the minister's heard me mention this in the House before, it is in the document that AOC has presented, and that's the dialysis machine for Inuvik. And I know we've spoken with this before. I don't think it's a huge cost for the machine, and why I bring it up here. And likely the CT scan would likely be a little more that's in there. But the dialysis machine, I think it's very important. Hay River has one, Yellowknife has two. I have spoken with people in Inuvik that if they don't need it, they may need it in the near future, and it would just be an absolute shame if someone who's lived in that area their whole life or for 30 or 40 years now have to move because they can't get that medical service they need. So I know we discussed this, and I know there's an issue with finding the right people to be able to operate this machinery, but I can't help but think there's got to be a way to train someone to be able to do that. And I guess has the minister and has her department considered a way that we can potentially put a dialysis service in Inuvik? Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. I know that there was a review done, I think 2020. We do reviews on patients that with renal disease and where they are and what the needs are going to be. I'm not familiar I can get back to the member as to when the next plan review will be. I'm sure it's going to be soon to just find that out. But another area that and this is part of our business plans is the chronic disease management, and this is a chronic disease. And so when we can better know and better control with our chronic disease management in the Northwest Territories, we'll have a better handle on what supports are needed in the Northwest Territories, and as well as doing more into the health promotion, and so we were preventing these things from happening. I know not all renal disease is preventable. Sometimes there's certain things happen in people's lives that this happen, but I will say that I will commit to making sure that we have another review done soon, to making sure that we see what the numbers are in the Beaufort Delta, that to require a service like this. Thank you.
Thank you. I will go to the member from Inuvialuktun.
Thank you, Mr. Chair, and again, thank the Minister for her answer. And I must say I was quite impressed as well when she didn't even flinch when I mentioned that the two other programs will dovetail nicely into her new aftercare facility she's building in Inuvik next year. So it's a good sign. No, that's all from me, Mr. Chair. I realize that we also have a CT scan in there. I know we're going to have a conversation around that. So I have no further questions, just to say thank you and keep it up. It's not easy.
Thank you. I'm going to go to the member from Frame League.
Thank you, Mr. Chair. Mr. Chair, I made some comments in my opening comments about the various kind of the sort of crisis that is being faced at NTHSSA, and I think I don't need to repeat those comments, but was hoping to get a response back from the Minister and Department ideas they're bringing forward to address these kind of issues.
Thank you. I'm going to go to the Minister.
Thank you, Mr. Chair. As I mentioned, you know, I mean, I've had these discussions on the floor of the House, so I'm not denying that, you know, there has been many concerns brought forward. I know that there will, you know, that the department is doing work. I know that there was an employee satisfaction engagement done, and the results of that will, you know, will help us guide some of the work. And, you know, we've heard from the members, we've met with some of the members and some people that are advocating for some of these changes. You know, that is one area, like I keep saying to my staff, that I'm like, I just want to be able to fix this, you know, and I, just like everybody else, I want people to go to work and be supported. I want people to go to work and feel like they, you know, that they want to be there. And so how we get there, it's going to take, you know, it's not going to happen overnight, because this issue didn't happen overnight. It's many years, you know, and I mean, it didn't help us with, you know, the COVID crisis in our healthcare system across Canada, not even across Canada, across the world. And so there's many areas that we're looking at to try and increase support to staff. There's to increase staffing. You know, one of the other members have raised, you know, international educated nurses. You know, my colleague from EC&E, we will be meeting with CAN to look at different ways on how we can support, you know, what's needed to support that. You know, how can we work, you know, so there are many things on top of all of the other things in health that we're trying to achieve for residents. And I understand, like, we need good staff, and we need happy staff to be able to provide those programs to our residents. So I'm not sitting here going to say that everything's perfect, and I know there things need to be done, and we've got some plans, and we've heard some recommendations, and how we get there. You know, I think it's going to take a little bit of everything. Thank you, Mr. Chair.
Thank you. We'll go to the member from Frame Lake.
Thank you, Mr. Speaker. And, you know, I think we've got a big budget to get through here. I'm not going to belabor this point. I do appreciate the Minister acknowledging the problem. I do want to see the department, you know, actively working on finding solutions, trying things. You know, we've talked a lot in the business plan about taking risks, breaking status quo. You know, don't be afraid to try things. And if it's not working, try something else. I can just commit to continuing to keep the pressure on as long as I'm hearing from constituents about these ongoing issues. Mr. Chair, I'm not going to repeat items that I think have already been raised by my colleagues and spoken to by the Minister, but I just want to say I strongly support midwifery in my community, and support many of the comments raised by my colleagues on health. But I'm going to leave it at that for this page. Thanks.
Thank you. I'm going to go to the member from Range Lake. Sorry, Satu.
Thank you, Mr. Chair. When I look at the programs and the funding and the grants coming in there, it sort of encourages me to say, here's solutions, as I mentioned several times here. I'm quite, I would say, quite proud about the actions taken by leadership to address the drug issue that we're experiencing right across the territory. But in our area, the leaders are grasping the problems and taking a hold of it, and doing some planning and having some consultations. And this coming after the weekend, they're going to listen from the youth. So the youth is going to raise their list of priorities, and it's going to be incorporated into this plan. So when I look at this funding, I see a lot of good supports there for resources to support the plan of transition and to eliminate the plague problems. But these problems are costing this government, I would say, millions of dollars. if we have to pay for a medevac, I don't know how much that cost is, but I can only imagine it's costing the government quite a bit just for the airplane, not to mention the staff and the treatment. And to help be more efficient on medical travel, will the department look at setting up a PY? We used to have, the SATU used to have a medical travel coordinator. It was taken and directed back to Yellowknife. But have we got any room for setting up a medical travel coordinator in the SATU? Thank you.
Thank you. I'm going to go to the Minister.
Thank you, Mr. Chair. Mr. Chair, at this time, I won't commit to that, because what I am committed to is in the business plan is taking a look at the medical travel and how we move people around is going to, you know, I'm hoping we'll be able to, I guess what I want to do is I want to implement by the end of this government a better way to move people, a way to make sure that when people have medical travel, and this is, you know, and are not as stressed about getting the medical travel as they are about having to go to the appointment that they're going for, you know, and I think we've heard that many times, and so I won't deny that, you know, that's sometimes the feeling, especially when you're not getting your travel on time or the day before, and we know that this is you know, there's many reasons why, you know, our staff are working hard. They have so many medical travel things in front of them. Like I said yesterday, I think our stats are just under 50,000 people we're moving a year. So, you know, with a small team, and so, you know, how I hear the member that if a position in Norman Wells is going to better support medical travel and the outcome of this, then, you know, then that I can see that being put forward as some of the change. But as of right now, I don't want to commit to any changes, and I don't want to put this on any person until we can, you know, we can really figure out how, like, and review the program and review how we're moving people in the Northwest Territories. Thank you, Mr. Chair.
Thank you. I'll move to the member from the SATU.
Yes, thank you, Mr. Chair, and thanks for that encouraging reply to the minister, by the minister. On my last trip, which was one way from Norman Wells to Yellowknife, it cost the government $1,800, and there's many cases where medical travel patients are coming here only to find out the appointment wasn't booked, but it was booked for a month later. Or other cases where people actually told me their experience. So that's why I say it's costing the government because of some mistake that was made, and it seems to be quite common for medical travel patients to come to their appointment when in fact it was the day before, the day after, or next week. So in the meantime, it's costing our government. So if we can look at, as the minister said, the movement of patients back and forth to their home community, on the spirit of efficiency, I still recommend having a PY to focus on movement of patients. But I'm encouraged by the minister saying that she will look at it. So thank you very much there, Mr. Chair.
Thank you. Next on my list here, I have the member from the Decho.
Thank you, Mr. Chair. My question is to the minister on X-ray machines in small communities. Do all small communities have X-ray machines? Thank you.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. All the health centers that have health center nurses in them do. The health cabins, however, do not. Thank you.
Thank you. I'll go to the member from the Decho.
Thank you. That's good to know, because these X-ray machines help with early detection of illnesses if there's people that have TB, pneumonia, or lung issues, and can save a lot of time from people getting medevac to Yellowknife or having to come for services here. If their illness is something like pneumonia, you just probably have to get I'm not a nurse, but I've had pneumonia, so I've had to take antibiotics, but the only time I've got tested for that was here in Yellowknife. So, yeah. So that one's that. I just needed to know: are all those machines in the communities working and in good working order? The other one I have is on community services. We're looking at that, and it's good that the department is supporting communities and addictions and stuff like that. Is the community, the house, doing anything with on the land healing? Is that something that this department is working on? Thank you.
Thank you. I want to go to the minister.
Thank you, Mr. Chair. Mr. Chair, just to the first part of the member's question, is the X-ray machines maintained? All the X-ray machines are maintained by our biomed, and they're all maintained in the communities. And to the next question, the On the Land program, Health is not running those types of programs. What the Indigenous governments have told us is that to make the funds available and more flexible for them, and so that's where the Community Wellness and Addiction Recovery Fund is, and so that where Indigenous governments from the communities can apply to access those dollars, and there's a fund, as I said, is a first come first serve, and so I would encourage, there is a staff member to help in community government, like the Indigenous governments, to do their proposals, to work with them, to support them to access those dollars. So I would encourage the member to, to provide that information to their Indigenous governments in their communities, and they can use those for On the Land. They can use them for hiring, mental health workers. They can use them to do youth programs, things like that within the community that are targeted for mental health and addictions. Yeah, so thank you.
Thank you. I'll go to the member from the Deschutes.
Thank you for the minister for that response. Is there a number for the budget and a length of time that they can run these programs? Is there, like, what's the max for the budget? Thank you.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. There was a set amount for regional governments to be able to apply as a region up until January 31st for multi-year funding. After that, after April 1st, then it opened up to Indigenous community governments, and so that individual Indigenous communities can apply up to 208 per. That one's for the regional.
You're right.
Yeah, $208,000 a year.
Thank you. I'm going to go to the member from the Deschutes.
Oh, thank you. And so that $208,000 a year, that's multi-year funding, so they'll get that for 3 years.
Thank you. I'm going to go to the minister.
Yes, I would encourage, like I said, it is a set dollar in the budget, and it is now open for first come first serve. So, and that's why I'm saying, like, I encourage people to reach out to if they want to run On the Land programs and they want to do these types of things in their communities, speak with their Indigenous governments in their communities, so that they can work with our department to access those dollars and do their, I think they're proposal based, but there's a set amount per community. Thank you.
Thank you. I'll go to the member from the Deschutes.
Thank you. That's all the questions I have for the minister for that one. Thank you.
Thank you. We have one more, and then I'm going to go to the member from Rangeley. Sorry.
Thank you, Mr. Chair. So the electronic medical record system is now deployed in all communities in the Northwest Territories, which is good, but unfortunately it needs to be replaced, which is not so good. And I understand that the replacement cost is somewhere between 20 to 30 million dollars. I know this is an issue because I was seeing my doctor recently, and the terminal in the exam room wasn't working, and the system was down, so we had to actually go to his office and figure things out there. So this and it's causing an inability for services to be shared with Alberta and a whole bunch of other hosts. So this is a thing that needs to be replaced urgently. What is the minister's plan to deal with this problem? Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Mr. Chair, again, this is one of the things that's in our business plan. I know I've had to ask questions because the timeline is long. We started rolling out the EMR before, way back when I was still practicing, and so and we finally just got it into the last community in the Northwest Territories. So now that we have to replace it is a I guess what to explain it is there's multiple systems, and so what the member is referring to is right now what we want to do is we're looking into when we design this system. I think the goal is that, we've heard many times that our system doesn't speak to other systems. There's things in our system that it doesn't do because it's old. And so it's taking in account of all of the things, we'll be working with our, the frontline staff, as the needs, the doctors, what their needs are, what we need to transfer, if there's a possibility that we can access, blood work. We've heard all of those kinds of things that when we're going into Alberta as one of our service providers. So it is a huge task. It is a large, there will be a large cost to that. So the RFP will go out in September for phase 1, and we're hoping that we'll be able to begin that process. Thank you.
Thank you. I'm going to go to the member from Range Lake.
Okay, thank you. That's more imminent than I expected. So, and that's good. That's good that we're moving towards that. So we spend an awful lot of money on the authorities, which is to be expected given the cost of healthcare. But often I think there's a disconnect between what the minister is accountable for and what the authority is accountable for. And certainly when it comes to some of these workplace issues we're hearing about, some of the performance of healthcare services, there seems to be that disconnect. And I think that the minister needs to be empowered to have more direct ability to direct the authorities and to change things if they're not working, instead of working through the board and all that. I think we see a healthcare system that's not performing optimally and that's not performing efficiently or effectively as well with the resources being provided. We keep giving it more money, and the results aren't changing that significantly, and I don't think the answer is just more money. So how does the minister propose to create more accountability and transparency around NTHSSA management, so the public can be assured that there's value for money in healthcare programs and services? Thank you.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. Mr. Chair, I hear what the member says, to keep putting more money in here, but if members keep asking for more stuff, we keep needing more money. But no, and I think one of the things that I will say is that, you know, within the department, there are many things that haven't been budgeted, and, you know, and I guess for health, knowing in the health authorities, this is all the frontline workers. So when we think about health centers, when we think about, you know, staffing the units, making sure that there's always it's not a place where you can just close, the nurse doesn't show up that day because they're sick or they have a sick kid. There's always areas where we have to make sure that is filled, and overtime over years and years and years and years has never been budgeted. So that's always been, you know, and I mean, I had my own system when I was a manager to make sure that we kind of limited how much overtime was happening, and making sure that, you know, people weren't working into third weekends and things like that, because those things drive up the costs that are not budgeted, and that's what's driving up the deficit. The thing when we talk about, there's more programs, there's new ways of doing things, everything costs more. Salaries are going up every year, and yet we're still trying to expand programming into 33 communities, and it is expensive. So when we talk about how do I, you know, I work with the Leadership Council, the budgeting process, you know, things that we are budgeting, making sure that those things are being spent on those things that are budgeted for. And that's why when we have things that aren't, you know, for years and years, if we have O&Ms that aren't being spent, or if we have positions that are vacant that are not, you know, we have to really, really look at all of those things and say, you know, where do we repurpose this money, and so that it's not just being spent into the department and we don't know where it's going. So I think those are the things that we've been working on. I know Minister of Finance is making sure that I'm making sure that I'm following that. So there is a lot of work though that still needs to be done, and I kind of, my department and finance have been working more together to kind of take more control and see where, not necessarily control, but where the money is being spent and how is it being spent. And the big part is that there's so many things that we are, as an insured service, that we are to provide. And then there's things, and then there's the other things. So those are the things that have been built into our healthcare system that we provide, that have been political, that have been over the years, that have been, you know, there's no that, you know, we keep saying there's gaps here, there's gaps there. So where do they fit in? They usually end up fitting in health, and then it's not something that it's in our core job to provide, but we end up providing it, because if we don't, then there's a gap in service. But those all cost dollars. So thank you, Mr. Chair.
Thank you. I'm going to go to the member from Range Lake.
Thank you, Mr. Chair. Is there, I appreciate where the minister's coming from, and there's always going to be a push and pull between the provision or the demand for services versus what the government can realistically provide. But when we have our auditors telling us that take a look at how we're spending health dollars because it's unsustainable and it's, you know, causing the government's public accounts to teeter on a knife's edge, that's a problem that we need to solve. So is the minister willing to look at different models of governance for the authorities that would allow more closer scrutiny, more control and accountability and transparency, and more action directly from the minister over the operation of the system? Thank you.
Thank you. I'm going to go to the minister.
Thank you. Thank you, Mr. Chair, and I hear the member, and you know, I'll echo what I've said is, you know, what we are funded for, and our core programs and services, and what we provide to the Northwest Territories. The things that are not covered in other territories and provinces that we provide over the years, that we have just, you know, we have decided as a government, and many governments up until now, that this is something that we need to provide to our residents, is why we are in the shape where we are. And every new thing that we ask for and we want to do that's not a core service of health and social service, that's a funded, insured service that we can be billing for, or, you know, from Canada, becomes out of our pocket. And so then it comes out of whatever the government's like whatever we have as a territory left. So, you know, we've been working on a lot of things, like I said, the NIHB agreement, trying to get that fully federal funding so that way that frees up those dollars. But even though we freed up $24 million this year, it goes to our operating costs that we normally would need to spend for our healthcare program. Thank you, Mr. Chair.
Thank you. And okay, thank you. Sorry, I'm going to go to the member from Yonge Centre.
Thank you, Mr. Chairman. Maybe just if it's been asked, maybe just a quick snap answer, which is how much money do we spend in aftercare? Thank you.
I'll go to the minister.
Thank you, Mr. Chair. I think as of right now for aftercare, what we have is the budgeted for THARP. Up until now, I don't believe we provided wellness, for homeless and things like that, but we haven't had fund up until this budget for aftercare, and that is where the THARP program falls into that. Thank you, Mr. Chair.
Thank you. I'll go to Yonge Centre. The member from Yonge Centre.
Thank you, Mr. Chairman. And exactly how much would that be? So in other words, what's the specific number dedicated to aftercare? Thank you.
Thank you. I'll go to the minister.
Thank you. This budget has 1.417, and that would be for the 2 THARP programs. Thank you.
Thank you. I'll go to the member from Yonge Centre.
Thank you, Mr. Chairman. Under Community Wellness and Addiction Recovery Support Fund, they look very similar to mental wellness and addictions recovery. So you have a we'll call it 055 budget and a $125,000 budget. What is the true distinct difference between the two? Why aren't they collapsed and put together? Thank you. Because they say similar things.
Thank you. I'll go to the minister.
Sorry, Mr. Chair, just trying to get that. Are you asking? I'm gonna have to get back to the member unless you can clarify which line item are you just.
Thank you. I'll go back to the member from the Yonge Centre to clarify.
Thank you, Mr. Chairman. Under Community Wellness and Addiction Recovery Fund, we have just over $3 million, and then under Mental Health and Addictions Recovery Fund, which is just over $100,000. What's the distinct difference to have two specific different line items? They say similar things, and I'm trying to understand why we don't collapse and make one. Thank you.
Thank you. I'll go to the the minister.
Thank you, Mr. Chair. Sorry, the 3.055 is the Community Wellness and Addiction Recovery Fund, the one that I keep kind of talking about that Indigenous governments can apply on, and that is separate from the Mental Wellness and Addiction Recovery Capacity Building Fund, the Mental Wellness and Addiction Recovery Fund, and the one here is 125 is used for the youth addiction prevention and youth detox model.
Thank you. I'm going to go to the member from Yonge Centre.
Of course, I'd recommend a 100% reprint of the whole budget just so we add the word youth. No, I don't. But I would recommend if it's targeted at youth, then we should put in brackets youth, just to help clarity. More of an edit there than concerns. So maybe we could jump to one of my favorite topics, doctors. Why don't we start with how many doctors do we have employed under this service and where do we find them? Thank you. In which authority? Thank you. When I say where do we find them?
Thank you. I'll go to the minister.
Thank you, Mr. Chair. You'll find doctors under all 3 authorities, and so that, like here, you'll see the grants and contribution and transfers when we transfer those dollars from the the department to the health authorities, and then and later on you'll see in the activities where the health authorities later in the budget, so. No, it's here. Is it? But we do have a list of all of the different, like, FPTs, and I think we have a subtotal of 56.5, yeah, regular physicians.
Thank you. I'm going to go to the member from the Olney Centre.
Thank you, Mr. Chairman. Mr. Chairman, amongst the three authorities, if I understand it correctly, could I get the breakout of how many in each authority and adding the specific dollar amount contribution to that allotment? So in other words, how many are in the Inuvialuktun authority and how much that's attributed to financially, and then successive ones? Thank you.
Thank you. I'll go to the minister.
We can provide that information to committee.
Thank you. I'll go to the member from the Olney Centre.
Thank you. Yes, I'll take that. Is it lengthy? Because that then makes it difficult to ask my next question. But I'll take it as well in paper. Thank you.
Thank you. I'll go to the minister.
Oh, yes. No, we can provide that to the member. Just, we don't have all of it. Like, I have the number, 56.5. How we break it out, I'd have to provide that later. Unless you want to sit here all night. We can calculate it.
Okay, thank you. I'm going to go to Yelney Centre, the member.
Thank you. It makes it difficult to ask my next question, but I'm willing to work with you folks. The challenge, of course, on my next question is I'd like to know what the normal staffing capacity at each region authority thereafter, including what dollar amounts are being not spent for doctors. So that makes it very difficult to ask my next question. Perhaps the minister sees where I'm going, and maybe someone, including yourself, is able to answer that. Thank you.
Thank you. I'm going to go to the minister.
Thank you. I'm going to pass it to my ADM, Jeannie Matheson, to see if she can help answer this question. Thank you.
Thank you. I'm going to go to the ADM.
Thank you, Mr. Chair. I'll speak in terms of FTEs. I don't have the dollars tied here on this page, but there are 56.5 funded family physicians, and 28.9 of those are currently filled. So that's about 50%. There are 25 specialists, and about half of those are also filled with residence doctors right now. So in total, 81 funded physicians, and 41 of them are currently filled. The vacancies are generally staffed with locums. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Yelney Centre.
Thank you, and I'm assuming you'll have the breakout provided in written form, so I won't keep beating that dead horse. So does the cost of the locums eat up the full remaining approximately 40 doctor spaces and I'm assuming the financial dollars, which I don't have here, but I'm sure you understand the point, is that do the locums eat up the remainder of the money? Thank you.
Thank you. I'm going to go to the minister.
Yes, we usually end up having all of the budgeted item for physicians used up by the permanent and the locum doctors, and sometimes we may even go over, so.
Thank you. I'll go to the member from Yelney Centre.
Yeah, no, thank you. With the response of the other written information that the minister said she'll provide, can I find out where outside the regular authorities we go? So for example, I'm assuming we don't have a doctor in Fort Simpson as an example, but do we send locums there? Is that charged to for example, the remaining amount? I'm trying to find out how we get doctors into the other regions outside of the main three, and what does that cost? Thank you.
Thank you. I'm going to go to the Minister.
Thank you, Mr. Chair. I guess each region, so I know in the Beaufort Delta, the physicians are scheduled to travel from, like if they're hired as indeterminate doctors in the Beaufort Delta or locums to fill the vacancies, they are all scheduled to, each community has its scheduled allotment of visits per month, and those doctors will service those communities. That's the same thing in the south. There's different models for different areas. I mean, if you want more detail, I can pass it on to the deputy minister to describe the south of the, and if there's the doctors from Yellowknife that travel out. Thank you, Mr. Chair.
Okay, thank you. Time ran out. Because we got the translators here, we're going to take a 15-minute break. Order. Okay, we're going to continue on. We're going to do a hard stop at 9:30, so less 10 minutes, so it'll be 9:20, so we'll continue on till 9:20, and then we'll get the speaker back in the House. We'll continue on. Next on the list I have here is the member from Yellowknife North.
Thank you, Mr. Chair. Now I know there's many things that I'd like to speak about, but I want to focus my limited time here, it's already late, on the midwifery program and my understanding of its potential. So my understanding is that a lot of work has actually happened over the last few years, even though it seems on paper that positions have remained vacant and the potential of the program has just sort of languished. What I've heard is that actually a lot of groundwork has been done to lay the framework for a territorial program, and that has been the focus. Is even though some work might need to start in Yellowknife or be based in Yellowknife. I shouldn't say start. There's already work that's being done in the South Slave, but what I'm understanding is that Yellowknife could play a really important role in a territorial-wide program. As my fellow members mentioned, there obviously are many births in Yellowknife, so it's an important training site. And the vision would be to expand the program to many other communities outside Yellowknife, but the fear is that if the YK-based portion of the program is, destroyed completely, that could actually jeopardize the program across the entire NWT. So one idea is that I heard today actually, potentially we could reduce the budget that was on the books for the last few years, but keep plugging away at the groundwork for another couple of years and keep laying the foundations to carry along that road towards the vision of a territory-wide midwifery program. I know that there are 2 midwives in training who are eager to begin work in YK once they're done school, and they're not done yet, but again, the pieces were being put in place, and just to sort of abandon that would be a real shame at this point. So what I would throw out there as a possibility is that we could stay the course, but perhaps pull back on costs from sort of the full amount that had been allocated from the program. What I'm wondering is if the minister would be willing to meet with the NWT Midwives Association to better understand this groundwork that has been done, the implications of just sort of cutting all of the expansion money at this point, and try to find some kind of reasonable compromise to not lose all the work that's been done up to this point. So would the minister be willing to meet with the association and consider options?
Thank you. I want to go to the minister.
Thank you, Mr. Chair. Yes, I'm always willing to meet with any groups, like I said, I'll meet with Indigenous groups, I'll meet with any groups, I'll meet with members, I'll and I hear the member, and I fully understand where this, like I said, these are some decisions that we had to make, but again, I'll leave it at that. Thank you, Mr. Chair.
Thank you. I want to go back to the member of Yellowknife North.
Thank you, Mr. Chair. I'm encouraged to hear that, and I think that we could. It's a promising start, and that we could still find a path forward. So I'll leave it there for today. Thank you, Mr. Chair.
Thank you. Is there any further questions? Seeing none, no further questions. Please turn to page 203. Health and Social Services Program Operational Expenditure Summary 2024-2025. Main estimates $384,586,000. Sorry, I didn't see your hand. I looked around, there was, okay, well, sorry, hang on, just a second. The member from Yellowknife North, I just had a quick question for you, is we had members speak out already and there are a lot of 10 minutes. Are you going to need 10 minutes? Okay, I'll give you the latitude. We'll keep it short and sweet.
Thank you. Thank you, Mr. Chairman. Just a couple quick, easy questions. The first one is fee-for-service doctors, and the minister asked me questions on the last one, and I couldn't answer because I ran out of time. But the only area I'm going to, in all respect of the time, and members are all getting tired, including myself. I'd like to know how many fee-for-service doctors we have in this section. So in other words, how many in total? And out of the locums that we hire, are they hired as fee-for-service? And can information specific to their types of costing, if possible, be provided? And I suspect, assuming that goes easy, that will tie me off for information-wise this time around on this page. Thank you. If it goes.
Thank you. I want to go to the minister.
Thank you. Thank you, Mr. Chair. We have one.
Thank you. I'm going to go to the member from Yellowknife North. Oh, sorry, Yellowknife Centre.
So I'm not going to drag this on. Just to clarify, we only have, that's not like 2 half-times. We're talking 1 doctor only in the Northwest Territories working for fee-for-service. Okay? I'm seeing nods. And our locums, are they working for fee-for-service, or I'm seeing no's. So I've answered my own question. That's all I need. Okay, thank you. I've agreed to move on. Thank you.
All right, thank you. Okay, I'm going to continue on. Again, please turn to page 203. Health and Social Services Programs Operation Expenditure Summary, 2024-2025. Main estimates, $384,586,000. Does the committee agree? Thank you. Moving on to the long-term and continuing care services. Beginning on page 207 with information items on page 210. Are there any questions? No further questions. I'm going to continue on. Please turn to page 208. Health and Social Services Long-Term and Continuing Care Services Operation Expenditure Summary, 2024-2025 main estimates, $72,657,000. Does the committee agree? Thank you. Moving on to out of territory services. Beginning on page 211, are there any questions? No further questions. Please turn to page, I'm sorry. My apologies. I want to go to the member from Yellowknife North.
Thank you, Mr. Chair. Just to confirm, we're on out of territory services, right? Okay. So the budget for residential care for out-of-territory services. So that would cover supportive living arrangements for adults in a residential or group home setting for extended periods of time in facilities outside the NBT. And so I understand that in many cases that the people that would require this kind of residential care might have very specialized needs or like particular conditions that can't be met with services or facilities inside the NBT. But I'm also hearing from the NBT Disabilities Council and other advocates that in some cases we have adults with certain challenges that could actually be met if there were increased supports for them to be able to stay at home, or assisted living, or ways that they could remain at home and remain in the community, and that it's actually costing the territory much more money by sending them out of the territory to live for extended periods of time. Sometimes they can't really come back and live. Has the minister considered or done analysis of the number of cases of adults being sent for residential care outside the territory, and how many might have benefited from better services inside the territory that could be provided that would assist them to stay at home and stay in their communities? Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Whenever there is, I think all of the patients, or all of the individuals that are supportive living out of territory, we do review them individually, case by case, to see if they're able to, what supports they are in the territory before we send them south. And we continue to review with supports that are in the territory, if there are clients that are living outside to be repatriated. I know that myself as a member on the other side asked this question. I think I said this was one of my favorite parts of the budget, to be able to ask that question, because it does cost the government a lot of money for those services that are, and we're at the mercy of whenever those contracts changed and increases, and so that's why we continue to monitor those services. Unfortunately, we don't have the capacity in the territory right now to repatriate those individuals, and so, but we do continue to monitor those files. Thank you, Mr. Chair.
Thank you. I'll move back to the member from Yellowknife North.
Thank you, Mr. Chair. So, as the minister mentioned, it's over $50 million for this particular item. That's quite significant, and I know we saw in our supplementary budgets that we approved a few months ago that there was an additional $12.5 million required on top of last year's allocated budget for this. So costs keep going up, even since 2022 to 23. Which was $38.5 million. We're now up over $50 million. So this is a significant driver of spiraling costs that I think needs to be looked at. Does the minister or her department keep any sort of like patterns or statistics to find out, if there's a large number of certain conditions or certain challenges that we're sending adults out of the territory for, and to be able to do some analysis of the costs of, if there's a significant number of people who all share the same challenge or condition, of providing that service inside the territory? Do we keep that kind of sort of higher level information to be able to do that analysis? Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Yeah, thank you. These clients are, and I hear the member, and I feel like I'm listening to myself in the last assembly because I see in the budget line, and I felt like the same thing is how can we support these individuals, and some of these individuals are from all parts of our territory, and so bringing those individuals, the support into the territory, into those small communities, these clients are the complexities of what their supports that they need are beyond what we can support them, and I don't think that, I think sending people to out of territory services is the last thing that we want to do, and so when we do have to make those choices to put them in the places that are the safest for them, that can service all of their needs, that's why the cost we see here. But I mean, that's the place that supports them the best, and we continue to review and continue to be able to see where and when and if programs change and and supports come in place, we'll continue to review those clients to see if there's supports that they can be repatriated. But at this time, majority, and they are complex, and so this is our option that we have right now. Thank you, Mr. Chair.
Thank you. I'm going to the member from Yellowknife North.
Thank you, Mr. Chair. And I should state too that this is, as the minister well knows, like this is not just an issue of financial costs, that it does put, it's a cost in terms of quality of life and cultural loss to take people out of the communities where, you know, their family is and where their culture is or where they were born and raised, to have them live somewhere else because we can't adequately provide for them. So, but I think that the minister does appreciate that, and I'm glad to hear that it's on the radar and it's something that we would continue looking at in the future to try to find solutions whenever possible to keep people inside the territory. Thank you, Mr. Chair.
Thank you. To the minister.
No, thank you for that. And yes, that's, you know, I hear the member, and I wanted to add too is, you know, these family members, you know, that we talk about, you know, they're far away from home, and so there is support for those families to be able to go out and visit with them, or bring, you know, if there is a family member with complex needs. Some of them are not as complex that, you know, and family members can't support them in the territory, but they can come for short visits and things like that. Like there's different ways that we do try to bring the families together as well, so that connection still happens. And so, but like I said, we continue to monitor this. Thank you.
Thank you. I'm going to go back to Yellowknife North, the member.
Oh, no, I'm done. Sorry. I thought...
Okay. Thank you. Thank you. Okay, I'm going to go to the member from Range Lake.
Thank you, Mr. Chair. Mr. Chair, addictions treatment facilities in the actuals in 22-23 were 2.5 million. The revised estimates in 23-24 were almost double that at 4.9 million, and these mains have the total estimates down to 3 million. So why are we budgeting, or why are we predicting that need will decrease by 1.9 million? Thank you.
Thank you. To the minister.
Thank you, Mr. Chair. With the facility-based addiction treatment program, the reason there is that we have been able to work with NIHB, and some of those costs to send people to addictions treatment will, and there are NIHB facilities, they have agreed that they will to pay for the travel, whereas before we were, you know, we were having to send all of the people to the programs that we have, and those were part of the expenses under this line item. And so now that we've been able to get an agreement with NIHB that they will cover those costs, then, you know, that should bring our numbers down. And when we look at the amount of people that are going, I think we're seeing more numbers that are going for treatment. Thank you, Mr. Chair.
Okay, thank you. We're just going to take a couple more minutes here. We lost our live stream, so we're just going to wait a few minutes to get that back up and running. At this time, I want to excuse the witnesses and the Sergeant Arms escort them. And thank you for your time, and have a good evening, everybody. Thank you.
Thank you, colleagues. Member from Toonaday-Willity.
Mr. Speaker, your committee has been considering table documents 93-20 brackets 1, and would like to report progress with 3 motion carried. And Mr. Speaker, I move that the report of the committee of the whole be concurred with. Thank you, Mr. Speaker.
Seconder, please. Member from Yellowknife North. All in favor? Opposed? Abstentions? Unanimous consent. Good job. Oh, I didn't see it. No recorded vote, it's all good. Third reading of bills. Third reading of bills. Orders of the day, Mr. Clerk.
Thank you, Mr. Speaker. Orders of the day for Tuesday, June 4th, 2024, 1:30 p.m. Prayer, minister statements, member statements, recognition of visitors in the gallery, replies to the budget address, day 6 of 7, reports of committees on the review of bills, reports of standing and special committees, returns to oral questions, acknowledgements, oral questions, returns to written questions, replies to the commissioner's address, petitions, tabling of documents, notices of motion, motions, notices of motion for first reading of bills, second reading of bills, consideration in committee of the whole of bills and other matters, Minister Statement 4, 5, 17, and 24-20 bracket 1, table document 93-20 bracket 1, report of committee of the whole third reading of bills, orders of the day. Thank you, Mr. Speaker.
Mr. Clerk. Colleagues, for you that are going home tomorrow, drive safely, fly safely, enjoy your weekend with your family and friends, and we'll see you bright-eyed and bushy-tailed on Tuesday. This House is adjourned, or stands adjourned until Tuesday, June 4th, 2024 at 1:30. 24, 23, 22. Order!